We have a very packed program today, and many speakers. So thank you so much for joining, and we appreciate your patience as we're waiting for some speakers to join us.
Yeah, hello everyone. Thank you for joining us. As you all know, this past Friday, it was 1,000 days of the genocide, and the genocide continues. Unfortunately, as Karama just mentioned, we really always struggle to find any good news. The bad news continues, the genocide continues. It's allowed to happen in front of the whole world view. Yesterday, we heard the news from our colleague Munther Abu Rabi'a for the tragic news of the murder of his brother, the older brother, the one who is doing the farm in Beit Lahia, and their younger cousin. We mourn their loss and we stand with our colleague. Hopefully, he will be joining us soon. But as you can understand, I think they are busy with funeral services. We also heard the news about our colleague, Dr. Hussam Abu Safiya. For those who don't know, Dr. Hussam Abu Safiya is the reason we have this webinar. This webinar was started from day one for Dr. Hussam and with Dr. Hussam. And since actually even a month before his abduction until now, we have been doing this weekly webinar for almost 2 years now. And it's all in his name and his colleague's name and in support of the people of Gaza. As you all heard, the lawyer visited him a few days ago, and unfortunately his situation continues to deteriorate. He's been undergoing extreme non-stop torture since the last high court meeting that they had, and it seems they're doing it as a revenge because he's trying to call for justice and for his release. And just the fact that he is reaching out to the court or trying to expose them, he's taking all of it on him and torturing him. We heard the harrowing news that he shared with the lawyer that he thinks or he believes that they brought him to this new detention place to kill him. And he is worried that this might be his last chance to meet with the lawyer. Of course, we are all heartbroken. The family is even more heartbroken about this. We have his son, Elias. Hopefully, his lawyer, Mr. Nasser Odeh, will be able to join us later. And our friend Naja Abbas from Physician for Human Rights in Israel might be able to join. He has some family issues. But the main thing today is we are going to be talking about Dr. Hussam, about Dr. Marwan Alhams, about our colleagues who continue to endure the unimaginable in these detention centers. And we call upon all our panelists here, all our friends, and all our audience. While we are speaking, please think of ways we can do, what strategies we can implement to help release them and demand an immediate visitation to them by the International Red Cross to make sure they are safe, to make sure they are being detained in humane conditions. And in the case of Dr. Marwan and Dr. Hussam, to get immediate medical attention and evaluation. So please, if you have any ideas, I know we did many petitions, we did many letters, we did many calls. So far, it seems we are not successful, so we need to think of something more impactful or other ways we can do or amplify our voice. Any ideas, please share them in the comments. We will be looking at the comments and we can brainstorm all these ideas at the end. Our panelists also, please, if you have any ideas, we invite you to share them after we hear from Elias and from the family. The daughter of Dr. Marwan Alhams. As you know, Dr. Marwan Alhams was the director of the field hospital in Gaza, who also has been abducted, and he's been undergoing torture since then. They even abducted his daughter, Tasneem, younger daughter, Tasneem, the nurse, for a couple of months as a way to add pressure to him, to force him to confess to crimes he did not commit. and he continues to be detained there and tortured without any charges at all. He's getting a court hearing every 45 days. Hopefully his daughter Aya will be able to join us to speak about that situation. But again, the main thing is, please, while we're speaking, think of ways, what else can we do to help our colleagues and to help in this genocide. So without any further delay, again, we have a long list of speakers. We will also hear from our colleagues who joined our press conference last week about the 1,000 days of genocide. Some of them will join us and speak today. But for now, I'm going to go with Ilyas Abu Safiya, the son of our beloved colleague, Dr. Hussam. Karama, do you want to say anything, or should we go with Hussam, with
No,
Ilyas? It's
yeah,
up to you.
please go ahead. Go ahead,
إلياس، أهلا وسهلا
Ilyas.
إلياس.
أهلا بكم جميعا.
يعني قلوبنا معكم، وأنا بعرف قديش والله صعب عليكم، الصراحة صعب علينا كلنا، وإحنا صراحة آسفين إنه خذلنا دكتور حسام وخذلنا كل أصدقاء الدكتور حسام وأهل الدكتور حسام. صراحة حاولنا كثير بالطرق اللي إحنا بنعرفها سو فار، للأسف يعني حتى الآن مش قادرين نساعده، بس لازم إحنا نضل نحكي ولازم نفكر مع بعض ونحاول. أي حدا عنده فكرة أو طريقة، وأنت إذا عندك فكرة أو طريقة أنت شو حابب نعمل، إحنا جاهزين نعمل أي شيء نقدر نساعد فيه دكتور حسام. تفضل إلياس.
نعم.
ولبس بعلمك معنا دكتور يوسف أبو ريش له صديق، ولا الدكتور حسام هون، فإحنا كلنا موجودين، إحنا جاهزين. عندك أي فكرة، أي شيء أنت حابب إحنا نعمله، أهلا.
طبعا دكتورنا الحبيب، طبعا في البداية بتوجه لكم بالشكر، يعني لأنكم يعني بتعطونا دائما مساحة لنتحدث عن قضيتنا الإنسانية. شكرا لمنظمة أطباء ضد الإبادة، وشكرا لكل الحضور الكرام كلا باسمه وبلقبه، وعلى رأسكم الدكتور الحبيب يعني دكتور يوسف أبو الريش. كلكم يعني بارك الله فيكم على جهودكم المبذولة من أجل قضيتنا الإنسانية. يعني صراحة أنا متابع لكل الجهود التي تبذل، وكل الأصوات الحرة التي تخرج من أجل يعني تنديد باعتقال والدي التعسفي، ويعني الظالم بحق والدي الذي يعذب منذ أكثر من 557 يوم بدون تهمة. فبارك الله فيكم على هذه الجهود وعلى هذه الوقفات المشرفة. فأنتم يعني صراحة يعني منظمة أطباء ضد الإبادة لم تقصر في حق والدي، وأنتم من بداية الاعتقال على تواصل معي، ويعني أنا أشهد بكل الجهود التي بذلتوها من أجل قضية والدي. ولكن إسرائيل للأسف لا تحترم أي منظمة إنسانية ولا تحترم أي قوانين دولية.
So first of all, Elias is thanking all of you for your effort and your continued support for his father and his colleagues, and he himself is paying attention to what we are doing, and he's thankful for that. And he knows that many people have been trying all what they can, but it is the impunity that Israel enjoys and have been enjoying since it was established illegally on our land that is allowing them to just ignore all our appeals and all our calls for humanity and for justice for the healthcare workers and everyone in Palestine. تفضل Elias.
نعم طبعا دكتورنا الحبيب، كلكم يعلم بأن والدي لا زال يعذب حتى هذا اليوم منذ أكثر من 557 يوم، وهو تحت التعذيب وتحت التنكيل وتحت الإدلال، ويعيش ظروف مأساوية وظروف كارثية وظروف صعبة لا تليق حتى في البشر. والله لا تليق هذه الظروف حتى بالحيوانات. للأسف الشديد هناك تخاذل يعني كبير جدا من المنظمات، يعني التي يعني الأصل أن يكون والدي محمي بموجب هذه القوانين وهذه المنظمات التي كانت تنص على حماية هؤلاء الأطباء الذين يعملون في بلاد النزاعات المسلحة. ولكن للأسف الشديد كل تشعر وكأن كل القوانين الدولية تصب في مصلحة إسرائيل ولا تخدم أي مصلحة أي فلسطيني أسير بدون تهمة في داخل السجون الإسرائيلية.
Nidal? I think Nidal is also having some connectivity issues. Okay, I'm going to try to translate. So So Ilyas is saying that the conditions that his father is enduring are extremely difficult and challenging, and it's definitely not appropriate for any human being to go through this. And it hasn't been 555 days, صح؟ 555 يوم أو أكتر.
557 يوم.
557 days of this continuous torture and continuous impunity, and denying him his basic rights, in addition to the torture. And the other thing that's really frustrating, and to be honest, it's outrageous, is the fact that all of the international organizations, like, the big, large INGOs who have a responsibility to actually put pressure on Israel to treat the prisoners, the hostages, with more humane ways, and also to follow due process legally, are doing almost nothing, absolutely nothing. So it's left for individuals to do the advocacy because of the failure of the international organizations, because of the failure of the states, and because of the failure of institutions like medical associations and others globally. تفضل.
للأسف الشديد طبعا قبل 3 أيام تمكن المحامي ناصر عودة من زيارة والدي، حيث روى لنا تفاصيل يعني قاتلة، تفاصيل صعبة، تفاصيل مؤلمة عن وضع اللا إنساني واللا أخلاقي الذي يتعرض له والدي في داخل السجون الإسرائيلية. تخيلوا وهو طبيب يعذب بأساليب والله لا نسمع فيها في حياتنا ولا نشاهدها حتى في أفلام الرعب. 5 من الجيش الإسرائيلي يدخلون على والدي، يعني وهم مقنعين الوجه، يقومون بضرب والدي بواسطة مطرقة حديدية لتكسير كل جسده. تخيلوا بأن المحامي عندما رأى والدي لم يكن قادرا على التعرف عليه منذ الوهلة الأولى. ظروف صعبة، وجه والدي كان مشوه، كان آثار التعذيب كانت واضحة جدا على وجه الوالد، وكان وجه والد ينزف الدم. وللأسف الشديد وهو طبيب بدون ذنب بدون تهمة، لا أعلم ما هو الجرم الذي ارتكبه والدي حتى يعذب وحتى يقتل أمام عيني، وأنا عاجز على أن أحميه أو أن أكون مكانه حتى يعني أشاركه ولو جزءا بسيطا من الألم. أين القوانين الدولية وأين العالم وأين المنظمات التي تدعي كرامة البشر وحقوق الإنسان؟ إلى أي درجة وصلنا من التخاذل؟ إلى أي درجة وصلنا من الانحطاط الأخلاقي حتى نشاهد يعني طبيب لم يكن يحمل سلاح، كان يحمل سماعة طبية يداوي بها الأطفال والمصابين والجرحى. للأسف الشديد لا حياة لمن تنادي.
Yeah, so the lawyer was able to finally visit Dr. Abu Safiya 3 days ago, and what he described was horrifying. The conditions, not only the conditions of his of the way he's held as a hostage illegally, but the systemic torture, the things that they heard from the lawyer are so horrific. Elias is saying you can't even imagine it. You have never even seen it in a horror movie. Things that are completely outside of like human comprehension. He mentioned that the lawyer couldn't even recognize him when he first saw him, because of the signs of torture that almost changed his features. So one of the examples is he will be, visited or attacked by 5 soldiers, so-called soldiers. Of course, these are not soldiers. These are torture agents who wear the masks, and they come and beat him up with metal rods. The intention is to break him physically, to break him emotionally, to break him psychologically, and just to break his humanity. And this is allowed because of this impunity that Israel continues to enjoy. Elias is saying that how is it fair that a doctor whose only weapon is a stethoscope is enduring all of this in front of everybody, with all the appeals that have happened? How is this allowed to continue to happen? And he's asking, how is it possible that his own son is not allowed to see him, or even like share the burden with him, with his own father? while the world continues to watch and turn away. تفضل ياس.
نعم، يعني صراحة ناشدنا العالم، ومن قبل كان والدي يناشد العالم بأن يعني كان يطلب منهم أبسط حقوق المرضى وأبسط حقوق الكوادر الطبية المحاصرين في داخل المستشفى. كان يناشد العالم بأنه لا يملك وجبة طعام واحدة تكفي لمصاب ومريض بحاجة إلى علاج وبحاجة إلى رعاية طبية. مجرد وجبة طعام الجيش الإسرائيلي حرمنا منها، نحن ككادر طبي ونحن كجرحى ومصابين وأطفال كنا محرومين من أبسط يعني حقوقنا الإنسانية، من طعام، من شراب، من دواء. وكان القصف وكان شبح الموت يلاحق والدي، ورغم كل التهديدات بقي والدي بجانب الأطفال والمرضى، لم يخذلهم ولم يتركهم. لهذا السبب والدي اليوم يعذب ويموت أمام مشهد كل العالم وكل المنظمات التي تدعي الإنسانية، ولا أحد يحرك ساكن، ولا أحد، يعني كلهم واقفين مكتوفي الأيدي. لا أعلم إلى أي حال وصلنا. يعني والله إنني أخاف من أن يكون الخبر القادم هو الخبر الأخير، والله يعني صدقا، والله إني أخاف أن أتواصل مع المحامي حتى لا أستمع إلى أخبار سيئة. يعني والله يعني قلوبنا تمزقت، والله نعيش حياة جحيم، والله نعيش حياة ليست بطبيعية. يعني والله نحن لا، يعني أنا أتكلم على مستوانا نحن كعائلة، وأنا أقع بالعتب الشديد على كل العالم وعلى كل المنظمات اللا إنسانية. والله نحن كعائلة، والله عندما نأتي للطعام والله نخجل من أنفسنا أن نأكل ووالدي جائع خلف القضبان. والله نخجل من أنفسنا عندما ننام على الفراش ووالدي والله لا يملك الفراش لينام عليه، ينام على الأرض. لماذا يعاقب والدي؟ على أي تهمة؟ هو ليس مذنب أو مجرم. هل أصبح علاج الأطفال والمرضى والمصابين ذنب يعاقب عليه القانون؟ أين القوانين الدولية؟ وأين محكمة جنيف التي تكفلت بحماية هؤلاء الكوادر حتى في دول النزاعات المسلحة؟ أين القوانين الدولية؟ لا أعلم يعني إلى أي حال وصلنا من الخذلان، وإلى متى؟ إلى متى سيقف هذا العالم متفرج على عذاباتنا وعلى إبادتنا وعلى الموت الذي يعني حل بنا، ولا زلنا نعذب، ويعني لا زلنا حتى هذا اليوم نعاني. ونحن والله والدي في داخل السجن يعذب ويعاني، ونحن كعائلة والله نعيش نفس الألم، ونعيش يعني حياة صعبة جدا، حياة جحيم، حياة لا تليق بالبشر. ننام والله على الألم ونستيقظ على الأمل، على أساس أن نستمع إلى أخبار جيدة عن والدي، ولكن للأسف الشديد يعني كل الأخبار التي تأتينا من داخل السجن هي أخبار مؤلمة.
Indeed. Well, the big question is, where is the humanity, right? Like what level of depravity is going to be okay, and what are we willing to tolerate? Just, if you remember early on with the DAG webinars, Dr. Abu Safiya actually he has made a few appeals. One of them was to President Trump, and a few of them were to the international community, because at the time he and his colleagues and the patients were all under siege. They were basically under siege by the occupation forces, and the way they were treated, even the patients were starved. One of the appeals was just like, can we please get food for the patients, for the sick people in the hospital who are actually getting starved because of the siege. And then his in exchange for that appeal, in exchange for his humanity, he was abducted illegally. He was abducted in front of all of us. He walked so bravely into the tank and was taken as a hostage, along with many of his colleagues. It's really hard to find the words to describe. Ilyas is saying that they're scared to even talk to the lawyer because they don't know what they're going to hear. They don't want to hear bad news. They're living in constant anxiety and fear because they don't know if this is going to be it. Like, is it today? Is it tomorrow? And the level of stress and the stress that this family is going through, trying to stay strong and resilient while knowing that their father is getting killed in front of everyone to watch, and tortured for no other reason than being a doctor and for wanting to stay and stick with his patients. And even the idea of eating food knowing that his father is hungry in prison, or sleeping on a mattress is painful, because they know that Dr. Abu Safiya sleeps on a bare floor, and has to deal with all sorts of health issues on his own with no help and no international interventions. So where is humanity? Where is the Geneva Conventions? Where are the Western values that talk about, you know, humanity and equal human rights for all and freedom for all? It's all a major lie. And, you know, unfortunately, Dr. Abu Safiya and many others are paying the price of the failure of international human rights and international law. Yes.
نعم، يعني صراحة والله يعني أنا لا أصدق بأنني يعني صراحة في بعض الأحيان تأتيني أوقات أشعر وكأنني في حلم، لست في علم، ولست في حقائق، يعني في حياة واقعية حقيقية. عندما أجد العالم يتغنى بالديمقراطية والقوانين الدولية، وأجد بأن والدي الآن حتى هذه اللحظة، ونحن يعني استصرخنا للعالم وناشدناهم وتوسلنا إليهم وأخبرناهم، وكل العالم للأسف يعلم الحقيقة، ورغم كل هذا يتجاهلون مصير والدي في داخل السجن. ليس والدي فحسب، بل نتحدث عن كل الأطباء. هذا واجبنا الأخلاقي والإنساني، بأن لا ننسى كل هؤلاء الأطباء. والدي أرسل لي وصية عبر المحامي، قال لي لا تتحدث عني أنا فحسب، بل تحدث عن كل الأطباء، لأننا جميعنا نعيش نفس المجاعة ونفس الألم ونفس التعذيب. ولكن اليوم الوضع مختلف. اليوم والدي يعذب عن أمة كاملة. اليوم والدي يعذب لأنه كان يرسل هذه الرسائل من حتى وهو من داخل السجن، يحاول أن ينقل المعاناة وينقل الألم والظروف اللا إنسانية التي يتعرض لها هو والأسرى في داخل السجون الإسرائيلية. يعني أنا يعني صراحة أرجو من كل العالم، من كل الأطباء، من كل أصحاب الضمائر الحية، أنتم يعني هنا في هذا اللقاء أنتم أطباء وتعلمون ما هو ثمن إنقاذ حياة إنسان. فكيف عندما يكون زميلكم طبيب يستنجد بكم ويستصرخ بكم ويتوسل إليكم بأن لا تنسوه وأن تنقذوه، وأن يعني تخرجوا للميادين وللشوارع وللمنصات الإعلامية ولكل الأحرار العالم ولكل المسائل والحكام ولكل منظمات حقوق الإنسان والمنظمات التي تدعي الإنسانية، بأن تتحدثوا عن قضية الأسرى، عن قضية والدي، عن قضية كل الأطباء الذين يعذبون في كل صباح وفي كل مساء بدون أي تهمة، بدون أي تهمة. لو كان هناك تهمة واحدة لكان الجيش الإسرائيلي استعمل هذه التهمة ليبرر جريمة اعتقاله وتعذيبه للكوادر الطبية في داخل السجن. لذلك علينا أن نتحرك بشكل عاجل وفوري لإنقاذ ما يمكن إنقاذه من حياة والدي وكل الأسرى في داخل السجون، وخصوصا الأطباء.
So Elias is saying that you know, his father actually sent him a message through the lawyer asking him not to only advocate for him, for Dr. Abu Safiya, but to advocate for all the hostages that are held in the Israeli detention and torture camps, because all of them are going through this. All of them are going through this. I mean, Elias is saying it just really feels surreal. Like it feels like sometimes he wakes up like with this feeling that this can't be real. Like this can't be real. Like for sure, if people see what's happening, they would do something. They would move. They would just, you know, go to the streets, call their elected officials. Somebody somewhere will have to intervene. But this silence is insane. This silence is insane. And he's saying, he's appealing to all the audience, to all the listeners, all the healthcare workers, that, you know, you all know what it means to save a life. It's such a sacred part of being a healthcare worker. What about saving your colleague? What about saving somebody who has spent all his life and risked his life trying to save one patient at a time? So he's appealing to all of us to take every step possible, to take every action possible, to do something to save what can be saved before it's too late, because it could be too late. And we are all responsible. We are all accountable, and we need to figure out a strategy that we haven't tried, right? Like we can't keep doing the same thing and not get any results. And so this time it's different. This time it's life and death, and it's for sure it's not for the lack of knowing. I think we all know what goes on in Israeli detention centers, and we need to move beyond what we've done. We need to intensify the action and to come together with a strategy of action that's going to be effective and massive, to be honest. Yes.
نعم طبعا، يعني أريدكم أن تتخيلوا للحظة واحدة فقط، لوهلة واحدة، عندما تتخيلوا دكتور للأطفال وهو والدي يعذب الآن ويضرب بمطرقة حديد، يعني لا يعني صراحة مطرقة حديد، يعني تخيلوا بس هذا المشهد عندما يكون في زنزانة يضرب بمطرقة حديد ويكسر كل أعضاء جسمه، وعندما يعني لاقى المحامي لم يكن قادرا على أن يجلس على الكرسي من آثار الألم، يعني لم يكن قادرا على أن يكون في وعيه، كان يعني على وشك أن يفقد الوعي عدة مرات، لم يكن قادر على أن يتنفس، لم يكن قادر على أن يتكلم وأن يشكو من هول أهوال يوم القيامة الذي يعيشها في داخل السجن. كان خائف لأن كانت الجنود تحيط في هذا اللقاء، وكان خاف يعني يخاف أن يتكلم بما تعرض له حتى لا يزيدوا من انتقام، يعني انتقامهم ووحشيتهم وأساليب تعذيبهم. لذلك نحن الآن يجب علينا أن نركز، الآن والدي في خطر وفرصتنا هذه هي الفرصة الأخيرة، هذه الفرصة الأخيرة يجب أن يكون هناك وقفات جادة، يجب يعني أن نخرج للإعلام، كل من يستطيع أن يتكلم، كل صوت يصنع فرقا، كل إنسان يستطيع أن يعني يتكلم في قضيتنا، يعني نكون شاكرين جدا له، ويعني نتمنى من كل العالم ونتمنى من كل يعني إنسان يستمع إلى هذه الكلمات وإلى هذه يعني الظروف الصعبة، يعني الكارثية القاسية المؤلمة، أن يعني يتكلم وأن يفضح جرائم الاحتلال بحق الأسرى في داخل السجون الإسرائيلية. الوقت ينفذ، وربما سيكون يعني صمت العالم يعني يتحول إلى ندم لا رجعة فيه، ربما سيتحول هذا الصمت إلى ندم لا رجعة فيه، وتكون قد انتهت هذه القضية بشكل كامل، وأصبحت يعني للأسف الشديد قضية منسية وسط كل هذه الانتهاكات التي تحصل في داخل السجون الإسرائيلية.
شكرا الياس. Um, yeah, he's basically asking us, imagine my father is a pediatrician, so he basically treats children, saves children's lives, and he spent all his life dedicated to this. He is being held as a hostage illegally for 557 days, subjected to brutal torture. When the lawyer saw him last time, he was so tortured, he was so broken that he couldn't actually sit on a chair because everything was kind of so raw. Basically, his body was raw. And he was in so much pain. But most importantly, he was very scared. He was very scared to talk to him about what they were doing to him because of retaliation, because that's what Israel does. If you say a word, if you open your mouth, you pay the price in torture. And Ilyas is saying, do everything you can. This is not just a regular appeal. This is like a call to everyone with a heart, with a pulse, with conscience, to do everything you can. Find somebody with influence and talk to them, and don't talk to them once. Keep talking, keep appealing and keep advocating, because it can get to a point where it's too late. It's too late, not just for Dr. Ilyas, for Dr. Hussam, but for others, for other hostages in Israeli detention centers. And it's also too late for humanity, because if we accept this, if we allow this to happen to a pediatrician who's done nothing wrong other than stand by his patients, then shame on us and shame on humanity.
Yeah. So Ilyas is thanking all of us for doing and advocating for his father and for everyone else in the last 557 days. But it seems whatever we did was not enough. And I think it is part of the Israeli strategy to make us feel hopeless and helpless, to make us believe that whatever we do is not effective. So I think this is, in a way, a call for all of us to try to do more. Maybe this is a time for the global medical community to make a more coordinated and more organized and more forceful response. Again, as Elias said, this is not just a regular appeal. This is not just about person being detained in prison awaiting his, legal procedures. We are talking about 10,000 hostages who are being tortured, raped, and murdered. We already have more than 100 of them murdered in the last couple of years. So the risk is real. It's not hypothetical. We know about our colleague, Dr. Adnan al-Bursh, who was also murdered in these Israeli torture camps. We honestly have a few more days to act. The way the lawyer described the situation of Dr. Hussam is we don't have more than a week. He himself feels that they brought him to this new place to be killed. They hit him with a hammer. They tortured him with a hammer. Imagine torturing someone who's been in jail for 557 days. He's already starved, already lost half of his weight. He has health conditions. He has torture and bruises everywhere. To be tortured with a hammer and hit with a hammer. The fact that even the prison guards cover their faces when they see the lawyer, they know they are doing something wrong. Because that is not a normal procedure for prison guards to cover their faces unless they know they are doing something wrong and they don't want to be seen, they don't want to be recognized. And for those of us here in the United States, we know that this is also what ICE does. If any public servant anywhere else in the world is doing their duty, they have no need to cover their faces. Covering their faces means they know they're doing something wrong and they are hiding. They don't want to be held accountable. Again, Israel intention and Israel goal is to make all of us feel helpless, and whatever we do is not going to help. So we should not fall into this trap. We need to do more and make sure that they release him. They make sure that he and his colleagues get the proper care and the proper legal, counseling that they need. They deserve. They need to be released. Again, this is a pediatrician. He did not commit any crime. The fact that they have nothing on him is that to this point they did not charge him with any crime. As Ilyas said, if they had anything on him, they would have said this publicly long time ago. They would have broadcasted this all over the world. And this applies to Dr. Hussam, this applies to Dr. Marwan and all their colleagues. None of them is being held with a specific charge. They have no charges. The only reason is they want to break them, they want to kill them. It's part of the genocidal and ethnic cleansing campaign against all the people in Palestine, especially the healthcare worker, because healthcare system they know is one of the systems that keep people alive. It brings hope to people that they still you can get some help. So part of breaking the healthcare system is part of breaking the whole people. We also have here the daughter and the son of Dr. Marwan Alhams. And again, I think Ilyas' call is for all of us to think, and please, let's do something more. And we mean immediately, this week, this coming week. We need calling letters, we need calling campaigns, we need to talk to our hospital, to our colleagues. We might even need to consider a global medical strike. We need to do something that really, really exerts pressure on our officials, on our institutions to do something about it. تفضل إلياس.
نعم يعني دكتور، قبل أن نختم بسبب يعني وجود عدد من اللقاءات أريد أن أوصل هذه الرسالة ونذكر كل الأعضاء الكرام الأطباء الأشقاء هنا في منظمة أطباء ضد الإبادة. أنتم يعني أطباء وتعلمون كم هو قاسي وكم هو صعب بأن تشاهدوا زميلكم الآن يعذب بدون رحمة خلف القضبان. وعندما قال الوالدي للمحامي ربما ستكون هذه آخر مرة تراني فيها وجاءوا بي إلى هنا لقتلي، هو لم يقول للمحامي فقط، بل هذه الرسالة إلى كل الأطباء الزملاء وإلى كل أحرار العالم وإلى كل من في قلبه ذرة من الإنسانية وإلى كل الأحرار وإلى كل من في قلبه ذرة حتى من الدين، ليقول له ربما سيكون هذه اللحظة الأخيرة وربما ستكون هذه النهاية. لذلك على كل الشرفاء أن يتحركوا كل أسير في داخل السجن له عائلة تنتظره، لديه أطفال ينتظرونه على يعني الأطفال يعيشون على الكذب. يعني هم لا يعلمون لماذا يعني والدهم أو الأسير يعذب بدون رحمة، يعني بدون تهمة في داخل السجن. لذلك هؤلاء الأسرى لديهم أطفال. الدكتور مروان الهمس لديه أطفال، والدكتور أحمد الكحلوت، والدكتور غسان أبو زهري، والكثير. والله أنا أتحلى بالشرف العظيم عندما أتحدث باسم كل أسير طبيب يعذب الآن داخل السجن. والله واجبنا الإنساني وواجبنا الأخلاقي أن نتحدث عنهم وأن نتذكرهم وأن ننقل معاناتهم. نحن الأمل الوحيد. الآن هم يعيشون في خطر يعني صعب جدا في داخل السجون الإسرائيلية. واجب علينا أن نتحرك. هذه الفرصة الأخيرة، ربما ستكون يا دكتور هذه هي النهاية. بعدها لن نستطيع أن نتكلم في هذا الموضوع. يعني لا أعلم إلى أي وقت سنقف عاجزين. يجب علينا أن نذكر كل المنظمات وكل يعني المؤسسات التي تدعي حقوق الإنسان. نرجو منكم أن تتذكروا بأن لكل هؤلاء الأسرى يعني هناك أطفال وهناك عائلات وزوجات وأمهات وآباء ينتظرون أي خبر مبشر عن هؤلاء الأسرى. ولكن للأسف الشديد كل الأخبار التي تأتي كلها مؤلمة وكلها موجعة وكلها جحيم. لذلك نرجو عليكم ونتوسل إليكم كل الأطباء وكل الأشقاء هنا، كل من يستطيع أن يتكلم، كل من يستطيع أن ينشر، كل من يستطيع أن يتداول هذه الأخبار وأن ينقل المعاناة. لا تنسوا أنتم الأمل الوحيد. يعني لا تجعلوهم يقتلون والدي خلف القضبان بدون تهمة. هو زميلكم. عندما أرسل رسالة للمحامي هو لم يرسلها للمحامي فحسب، بل هي لكل من يسمع هذه الرسالة. لذلك نتوسل إليكم كل من يستطيع أن ينشر، كل من يستطيع أن يتكلم، كل من يستطيع أن يعلق بأي شيء. كل صوت يصنع فرقا. لذلك كل الحب وكل الاحترام وكل يعني المحبة والتقدير لمنظمة أطباء ضد الإبادة ولكل الحضور الكرام ولكل الأطباء الأشقاء. وبارك الله على بارك الله فيكم على جهودكم وعلى مواقفكم المشرفة. ونأمل منكم المزيد لإنقاذ حياة والدي وإنقاذ الدكتور مروان الهمس والدكتور أحمد الكحلوت قبل فوات الأوان وقبل أن يعني يحصل ما كنا نخشاه.
Shukran, Ilyas. Thank you, Ilyas. Again, Ilyas is emphasizing the urgency of the situation. We're talking about a life or death situation that might happen the next few days. We don't really have too much time, few weeks or few months to brainstorm what can we do. This is something that has to be done this week. It is a top emergency. We are calling upon all of you to do everything you can to save our colleagues. These are all our colleagues. These are people who committed no crime. They have no charges against them. They are being held illegally under an illegal system. They are being tortured. They are being killed. They have families who cannot sleep, who cannot eat, who themselves are feeling the brunt of this torture. They are feeling they're living this nightmare that they might hear the worst news any minute. We're calling upon all of you, please, wherever you are, start your own campaign. Give us your ideas. Call your medical organizations. Call your foreign minister. Call your elected officials. Keep calling them. Add pressure on them. Make sure their phone lines are all four lines are busy with calls all day, all night. This is the only way to make sure our voice is heard, and that to make sure that we will not let them do business as usual as long as our colleagues are being murdered in front of our own eyes. Please call 10 times every day. Ask your friends to call. Call every official, every foreign minister, every diplomat, every Israeli embassy, wherever you are. We are calling about on our colleagues here in the United States to call the Israeli embassy. We're gonna start maybe a calling campaign. Call the Israeli embassy all day, all night. Make sure that they will never do business as usual as long as our colleagues are being murdered at the hands of their, criminal soldiers. Call our foreign ministry here or State Department. Call the American Medical Association. For those, the phone numbers of the Israeli Medical Association are also public. If you can call, please we have a calling campaign for the Israeli Medical Association, because they always claim, and they have been claiming since the call to reject them from the World Medical Association, that they are not part of this. But if they are truly not part of this, they should be the first ones to issue statements for the release of these doctors. The Israeli Medical Association, please call their numbers every day, wherever you can, anyone who can. Their phone numbers are public. The Israeli Foreign Minister phone numbers are public. The State Department in Canada, in Europe, wherever you are, call the Canadian Medical Association, call the American Medical Association, call the Department of Health and Human Services, call the White House. We need to spend this week making calls day in, day out, until our colleagues are safe and are released. Shukran, Ilyas. We feel you, we hear you, and yes, there is more we can do. There is more we can do, and Israel wants us to feel the despair. Israel wants us to feel hopeless, but we are not hopeless, and I am sure if we really intend to do it, we will cripple every institution that has anything to do with this. We will not allow them to do business as usual as long as our colleagues are being murdered and tortured in front of our eyes. So please do not feel desperate. Every ounce of anger, every ounce of rage about what is happening, we have to channel it into action. Each one of us can make 10 phone calls a day. It is free. Pick these numbers, or pick any institution you think can help in doing this, and ask your colleagues, ask your circles, ask your family, ask your friends, ask us, remind us to make calls every day and every night. Leave messages, leave emails, send letters. We want to make this coming week, a week they've never seen before. And we want to make sure that the world will not go to business as usual as long as the 10,000 hostages and our colleagues are being tortured in front of the world eyes. And we need to break the impunity that Israel has enjoyed for the last 100 years. In regards to our colleague, Dr. Hussam, Dr. Marwan, honestly, I hate to say it, but it is now or never. In a week or two, they might not be with us. It might be too late. This is a top emergency call for everyone, please. Wherever you are, let's do it this week. Even if we have to stay home and not do anything, in 2-3 days, we can make their voice reach every office, every institution. This is a final call for humanity from our colleagues, from their families, from Ilyas, from all the doctors. We have here also the family of Dr. Marwan Alhams. I think we have his daughter Aya, and we have his son Muhammad. Aya, are you with us, or Muhammad? Anyone? Can you open the camera, please? Yes, I know you have an event that you have to go to, so please stay with us for the time being, whenever you can.
الياس الله
And
يعطيك العافية. الله يعطيك العافية يا الياس،
الدكتور يوسف،
وقلوبنا
تفضل
مع
دكتور.
العائلة، وسلامنا للأهل، وإن شاء الله خرج قريب.
لا طلعش من تفصيل.
شوية
حبيبنا
محمد، خلي الدكتور يوسف
دكتور.
يكمل.
نعم تفضل دكتور.
تفضل دكتور يوسف.
نعم. دكتور حسام، يعني لن يسقط من ذاكرة أحد ولا من قلب أحد ولا من عقل أحد، والجميع يتشرف أن يكون لسان وصوت لهذه القضية العادلة. قلوبنا معكم، وليست فقط قلوبنا وإنما قلوبنا وأصواتنا وأفعالنا وزملائنا في مؤسسة أطباء ضد الإبادة، كما كل المؤسسات كلها إن شاء الله ستقف الموقف المشرف الذي يليق بها، وكلنا أمل أنه سيكون بإذن الله قريبا بيننا. طال الزمان أم قصر، سيكون بيننا إن شاء الله. بالله تسلم على الوالدة، بلغها يعني كل المواساة والتآزر معها ومع جميع أفراد العائلة، بإذن الله فرج قريب.
يا رب، نسأل الله ذلك. بارك الله فيك يا دكتور على هذه الكلمات الطيبة، ويعني صراحة يعني شكرا كثير. احنا دائما يا دكتور بنستمد يعني معنويتنا وقوتنا منكم، خصوصا أنتم يعني قدوتنا وأحبائنا. دكتور يوسف ما شاء الله عنك من بداية الحرب وأنت قدوتنا، وإحنا كلنا بنحبك وكنا بنفتخر فيك. فشكرا لك على هذه الكلمات الطيبة وعلى هذه الكلمات الرائعة. ونسأل الله تعالى إن شاء الله الفرج القريب عن والدي وعن الدكتور مروان الهمس وجميع الأطباء الأسرى المعتقلين. يعني هؤلاء الأبطال الذين نفتخر بهم كلا باسمه ولقبه. فشكرا يا دكتور وبارك الله فيك على هذه الكلمات، وإن شاء الله الفرج قريب بإذن الله تعالى.
شكرا لك ولمشاركتك ولهذا الصوت ولهذا الإدراك باللحظة. شكرا لك.
شكرا يا عم، شكرا، بارك الله فيك.
الله عليك.
الله
شكرا
يحفظك.
Dr. Yusuf. Thank you, Ilyas. Thank you, Dr. Yusuf. Again, this is to re-emphasize. If anything happens to Dr. Hussam in front of all our eyes, it will be something that we ourselves will regret forever, that we allowed this to happen in front of our eyes. Please, 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 let's do everything this week. This week. Feel free to organize your own campaign, do everything you can. We don't want to live with this lifelong guilt of allowing Dr. Hussam or any of his colleagues to be murdered in front of our eyes, while the whole world, the whole international medical community, and we know that the medical community is a very effective and very powerful community everywhere. The medical community can literally paralyze every country, every government, if they really choose to do so. And especially if we are doing it for this humane reason and to stand up with doctors, with our colleagues who did nothing wrong other than stand up for humanity and for their patients. Yesterday, one of the Supreme Justice judges in Israel shared a tweet saying that there was a Polish Jewish doctor in the 1940s. He was also a pediatrician, and that doctor was taking care of an orphanage, and he was one of the leaders of starting the pediatric specialty, and he has a lot of writings and books about pediatrics and taking care of the patients and the children and the orphanage. The Nazi soldiers ordered him to leave the orphanage and leave his work. He refused to leave the orphanage. He insisted on staying there, taking care of the children there. So they ended up abducting him and the orphans, and they took him to the ghetto camp, Warsaw ghetto camp, and he ended up being murdered there, along with many of the children. Later on, those who murdered him were charged with war crimes. This Israeli judge is saying this to the head of the Israeli High Court to remind her that failing to release Dr. Hussam and his colleagues is grounds for them to be charged with war crimes later on, because these doctors did not commit any crimes. The only crime Dr. Hussam and his colleagues committed is to refuse to leave their patients and to refuse to betray their profession. So history is repeating itself, unfortunately, with worse outcomes. We should not let this happen again. We should not let this happen in front of our eyes. And we are not helpless. We are not powerless. We can do it. Do not fall into despair, because this is exactly what Israel wants us to feel. And now let's go to Aya. She's the daughter of Dr. Marwan Alhams. Dr.
السلام عليكم
Marwan.
ورحمة الله. السلام عليكم ورحمة الله وبركاته.
Ahla sahla, Aya. So Dr. Marwan Alhams is also, he used to be the head of the Gaza Field Hospital. He was abducted also a few months back, and he's been undergoing torture, inhumane conditions, denied health care. At one point, because he has a heart condition and he was not treated for that, his heart stopped and he was taken to the hospital, resuscitated, but he continues to be denied his medication. We have his daughter and his son to share their story with us. صهيب اهلا وسهلا تفضلي. اهلا وسهلا فيك.
أهلا بكم. السلام عليكم ورحمة الله وبركاته. معكم آية بنت الدكتور مروان شفيق الهمس، الابن البكر لوالدي الدكتور
اهلا وسهلا
المختطف.
آية.
أهلا بك. والدي اختطف في تاريخ 21/7/2025 حيث كان ذاهب لمستشفى الصليب الأحمر لإجراء لقاء هناك، وهو أيضا والدي مدير مستشفيات ميدانية كما تعلمون. فتم اختطافه بطريقة بشعة وإطلاق الرصاص عليه وإطلاق 4 رصاصات في قدمه، ومما أدى إلى إصابته ونقله بعد ذلك من قبل قوات خاصة إلى داخل دولة الكيان الإسرائيلي. ونحن إلى هذا اللحظة لم نرى له صورة، لم نسمع له صوت، لم نشاهد له فيديو، وقلوبنا تعتصر بالألم جدا على والدي الأسير الدكتور مروان الهومس.
طيب آية خلينا نترجم. So Aya is the eldest daughter of Dr. Marwan Alhams. He was the head of the field hospital in Gaza. He was attacked. He was shot at and abducted on July 25, 2025, or July 21, 2025, which makes it almost 1 year now. Since then, the family did not see him at all, did not have any opportunity to visit with their father. All what they know is that he's been treated in inhuman conditions, and they're the same as with Dr. Hussam, worried about his life and about well-being. تفضل.
والدي الدكتور مروان بعد يومين من اعتقاله علمنا أنه في سجن عسقلان من قبل منظمة الضمير لحقوق الإنسان. فلم نسمع قنط في السجن تقريبا ما يقارب 6 أشهر ونحن لم نعلم عنه أي خبر. كانت قلوبنا دائما يعني صحيح دائما احنا كنا بنستنى نسمع له خبر، يعني نعرف كيف صحة والدي، كيف هو، كيف ايش بيعاني، باكل، بيشرب، بينامش، كيف وضعه، هل باخذ دواء لرفة القلب، يعني والدي يعاني من رفة القلب. فمما وصلنا من المحامي إن والدي الآن في فترة تحقيق وتعذيب، ولا يمكن أن نعطي لكم أي خبر في هذه الفترة.
طيب Aya. So Aya is saying that for the first 6 months they did not hear anything about their father. They know he was shot. He had 4 shots or 4 shot wounds at that time. And since then, once the lawyer was able to see him, all what the lawyer is sharing that he is going constant interrogation until this point, constant torture. His court is being done every 45 days, which is different because even until now, they did not designate him as a lawful combatant or as administrative detention. Dr. Marwan has a heart condition. Before he was attacked and shot at and injured. He has heart palpitations, and he is not been given his medication or the required medical care. تفضلي آية.
بعد ذلك تم نقل والدي لسجن رمون، ومما وصل إلينا جديد أن والدي خسر من وزنه 20 كيلوغرام وتعرض لتحقيق مستمر لمدة 43 يوم 1000 ساعة متواصلة. مما من خلال هذا التعذيب الذي تعرض له والدي وصلنا من المحامي أن والدي قد توقف قلبه عن العمل وتم نقله إلى مستشفى برازيلاي ووضع صعقة قلبية على قلبه لحتى يرجع إلى الحياة ومعالجته، لأنهم قاموا بأخذه وهو مصاب ولم يعالجوه فورا، بل قاموا بالتحقيق معه والتعذيب ثم نقلوه إلى مستشفى برزلاي ليعالج. عندما سمعنا هذه الأخبار كانت صدمة لنا بالنسبة لنا كعائلته وكأولاده وكإخوان أخواته. كان يعني إشي بقهر القلب وبحرقه. يعني إحنا في لحظة من اللحظات كنا يعني هنفقد والدي وإحنا مش دارين عنه ولا خبر. حسبنا الله ونعم الوكيل.
Aya is saying that her father, when he was detained, he had 4 gunshot wounds, and despite that, he was not taken for medical care. He was taken they subjected him to a continuous almost 1,000 hours of interrogation and torture, which resulted in him going into arrhythmia or cardiac arrest. They are not sure. At that time, he was taken to a hospital. I don't know the name of the hospital. I think July Hospital. لو سمحت mute please. Yeah. So in the hospital, he was cardioverted or resuscitated. And after that, they took him back and they restarted the interrogation and the torture again. The family is, as expected, heart broken. They're worried about his health. They're worried they might lose their father any minute because of the extreme inhumane condition he's been dealt with, the continuous interrogation, and the denial of medical and health care. تفضل يا ايام. انت ميوتد يا ايا، افتح الميكروفون الله يخليك، شكلنا سكر التليفون. افتح المايك لو سمحتي. افتح المايك. ايوه
تمام.
اهلا وسهلا.
مما أهلا بك. مما وصلنا أيضا أن والدي يقول بأن في السجن الآن الروماني الذي يخضع به الآن الغداء الطعام سيء جدا للغاية، ومن شهر 2 والدي لم يتلقى علاج أبدا لرفة القلب التي يعاني منها منذ أن كان هنا منذ أن قبل أن يدخل إلى السجن. ونحن أيضا وهو قال للمحامي أنا قلق جدا من أن يصبح معي شيئا في قلبي، وهم لا يريدون إجراء تخطيط إلي ولا راضيين إنهم يعطوني الدواء، وإحنا خايفين جدا إنه يصير في والدي حاجة، أو إنه إحنا ما نقدرش نشوفه ويضل في السجن ويتعذب وإحنا مش قادرين نعمل له أي حاجة. يعني أنا بطالب جميع المؤسسات الدولية.
خلينا نترجم. الله يخليك، خلينا نترجم. So
تمام.
to their knowledge, he's been held in the last few months in Ramon prison, which is another torture camp. What the lawyer shared that he's not been giving his heart medication that he needs. He's been subjected to bad conditions and torture. The food, as you all know, all the prisoners in Israel have been starved and receiving very little food, and whatever little they get is the worst quality. Dr. Marwan lost 20 kilograms of his weight, which is about 40 pounds, here. And the family is again very concerned that he might lose his life anytime because of the conditions that he's been subjected to. تفضل يا إيمان. افتح المايك الله يخليك. Open the mic.
تمام.
Yeah.
محمد بس دقيقة، خلي محمد لما يبقى يترجم
تفضل
الدكتور يكون محمد صامت عشان ما يعكرسش على الترجمة. تمام، بلغي محمد إنه أثناء الحديث يكون صامت. تمام
إن شاء الله.
إن شاء الله.
ماشي تمام. مما أيضا يعني والدي الدكتور مروان الشفيق الهمس إنسان، يعني كل من عرفه عرف أنه إنسان طيب حنون مخلص وفي، ذو قلب طيب جدا، يحترم الكبير والصغير، يعني ما عمره أذى حدا في حياته، يعني إنسان بتقول عنه إنسان بريء جدا. طب لماذا قامت دولة إسرائيل بأخذه بهذه الطريقة الوحشية وتدمير نفسيته وتدمير نفسية أولاده؟ لماذا قامت بذلك؟ نحن نريد أن نعلم ماذا فعل أبي حتى يلاقي كل هذه الوحشية من قبل قوات الاحتلال الإسرائيلي.
So Aya is asking why would someone like her father, who was a very kind person, he never did anything wrong. He has always been the best person for his family, for his patients, for his people. He never committed any crime. And the proof to that is Israel itself, because until this now, they have no charges at all against him. And what did he do to deserve all this torture, all this barbaric treatment at the hands of these, criminal torture camp forces. تفضلي يا آية.
نحن نطالب جميع المؤسسات الدولية وكل من له يد في أن يصنع فرقاً بأن ينظر لقضية الأسرى وخصوصاً الأطباء. والدي الدكتور حسام أبو صفية، والله يعني لما شفناه آخر مرة في صورته في الفيديو إنه يعني إحنا بكينا ألماً وحسرة على ما يفعل به الاحتلال. ما هذا الوجه الشاحب، ما هذه الصورة، ماذا وضعوا له، كيف هو نقول كيف والدي الآن؟ يعني عندما نظرنا للدكتور حسام أبو صفية قلنا هذا الدكتور حسام أبو صفية، فما بالك والدي؟ يعني الرجاء النظر لقضية الأطباء، وخصوصا الذين هم أيادي في الرحمة، إنسانيون، أناس طيبون لم يقدموا للاحتلال بأي صورة من الصور أي أذى. لماذا يتم معاقبتهم بهذه الصورة وحبسهم في سجون وتعرضهم للتحقيق وللتعذيب؟ لماذا؟ نحن نريد أن نعرف، ونريد من البشرية جميعها أن تقف وتتظاهر لإخراج هؤلاء الأسرى الأطباء من السجون حتى يرتاح قلوب الأهالي.
شكرا آية. So Aya is appealing to all people of the world, all humanity, especially the medical and healthcare organization, all the world, to please do everything to release her father and the other doctors and healthcare workers and the hostages there. These people did not commit any crime. They don't deserve this. Dr. Marwan Alhams' family did not get any picture. They did not see him at all since he's been abducted almost a year ago. The minute they saw the pictures of Dr. Hussam Abu Safiya, they felt they felt horrified because of this is what happened to Dr. Hussam. They are worried that their dad is even undergoing or worse might have happened to him. And they cannot even imagine what is the condition and how does their father look like at this point. They feel horrified for the treatment that Dr. Hussam and their father and all the hostages are being subjected to for no reason, for no crime. And again, they are appealing to all of us to please do everything we can to bring these doctors, these amazing human beings, bring them to safety and release them. تفضل يا آية. Karama, if you want to translate anything for her, please. Aya, are you still there?
Yeah, I'm happy
السلام
to
عليكم.
translate it all. If I wants to continue speaking.
Yeah. وين
السلام
زايا؟
عليكم.
وعليكم السلام. تفضل، مين
هلا.
بيحكي؟
السلام عليكم ورحمة الله وبركاته. محمد مروان الهمس،
أهلا وسهلا
من أسير
محمد.
الدكتور
أهلين.
مروان الهمس، مدير المستشفيات الميدانية في قطاع غزة.
أهلا وسهلا محمد.
الله يعطيك العافية. نطالب طبعا جميع المؤسسات الدولية وحقوق الإنسان والأمم المتحدة بالإفراج عن والدي بسرعة ممكنة، لأن الاحتلال يمارس معه سياسة التعذيب والإهمال الطبي والنفسي. والدي لم يقم بأي إجرام، بالعكس، بل كان والدي يقدم الدواء لكل مريض ولا يفرق بين أي مريض.
So Muhammad is the younger son of Dr. Marwan, and he's appealing for us, for everyone, all human beings, all healthcare workers all over the world to do everything they can to demand the release of his father and the other hostages. He's also saying that his father did not commit any crime, did not do anything wrong. And his father was, as Dr. Hassam and all their colleagues, they were the best people, the most kind people. They were always there for their patients. They were always there to help. They never did anything wrong, and none of them deserve to being tortured, to be humiliated, to be murdered, or to be abducted all this time. تفضل.
طبعا والدي عندما تم اختطافه تم إطلاق النار 4 طلقات في رجليه، وتم إصابته أيضا في يديه، في كتفه أيضا، وأثناء تم أخذه تم إصابته أيضا في
أشر عليها يا محمد، مش مشكلة، أشر وين المنطقة هاي؟ أو تفضل يا آية. آية افتح الميكروفون، الله يخليك، مسكر الميكروفون.
يعطيكم العافية. معلش محمد هيك يعني ما قدرش يكمل.
بهمش محمد متأثر كثير، الله يعينه، ما بنلوم. تفضلي.
بسيطة بعد الخير. أنا كنت والله حابة أحكي لكم إنه يعني والدي عندما دخل إلى السجن كان يعاني أيضا من تعب في قدميه، يعني كان مصاب في طلق ناري قبل أن يؤخذ إلى السجن. كان مصاب أيضا في حرب من الحروب التي قامت بها الاحتلال الإسرائيلي على قطاع غزة. أصيب والدي في قدمه، فقدمه متعب جدا، فيعني كان دائما يقوم بعمل كمادات لرجليه ويأخذ علاج. وعندما تم إصابته بأربع طلقات جديدة، لا ندري ماذا قدموا له. هل قدموا له العلاج المناسب؟ هل ساعدوه على أن يحرك رجليه بشكل مناسب أم لا؟
آية بنعرف إحنا وين الإصابات تاعته؟ عندكم خبر أو حكى لكم المحامي وين كانوا طلقات؟
والله الطلقات قالنا إنه طلقات في أوراق من رجل، في قدمه في الرجل، من طلقتان في رجليه اليمين، طلقتان في رجليه اليسار، في الأوراق منطقة الوركين.
Aya is saying that her father already has prior health conditions, heart condition, and he also had a previous injury to his foot. And when they came and abducted him, they shot him 4 times to his legs and to his thighs, which made his situation worse. And again, they are still worried what kind of treatment he received and whether he received or receiving the proper care. Most probably not. Again, she's reiterating her appeal for all of us to do all what we can to help. So, Dr. Yusuf, if you want to speak anything now, then we have with us now the Doctor Syndicate chair and vice chair here with us. We want to hear from them and hear their lead. What do they think we can do to help our colleagues in Gaza? Dr. Yusuf?
دكتور الله يعطيك العافية يا عم. إن شاء الله إن شاء الله إن شاء الله فرج قريب. أنتوا كلكم بعدين نسيتوا إنه دكتور مروان هو مدير مستشفى أبو يوسف النجار. يعني هو بالأساس دكتور مروان هو مدير مستشفى أبو يوسف النجار، وبقي في هذه المستشفى إلى أن تم إخراج كل من فيها والمرضى بالقوة، وتم تدمير مستشفى أبو يوسف النجار. لم يرضى دكتور مروان في حينه.
Dr. Yusuf,
Yeah.
can you say this in English, please?
Yeah. Actually, I want just to remind
okay.
all of our colleagues that Dr. Marwan, he was the head of Abu Yusuf al-Najjar Hospital, which the only general hospital in Rafah. Actually, he was the head of the hospital and he continued to work as a head of the hospital, although the hospital was under difficult situation, but he decided to continue working in that hospital till they distract the hospital and they push all the staff and the doctors and the patients to be out of the hospital. At that time, he have another decision not to go home and to have another file. And since that time, he was the head of the field hospitals and he was following the field hospitals. So he have a such decision not to go home and not to just continue watching the condition or the situation. So I just remember how he was insisted to continue working and to help the people and to help our innocent people under this difficult situation and this genocide. عم الله يعطيكم العافية. احنا قلوبنا كلها تعتصر ألم لزملائنا جميعا، وعلى رأسهم دكتور حسام ودكتور مروان والشهداء الذين مضوا والذين لا زالت أجسادهم يعني معتقلة. المعتقلين مش بس الأحياء، كمان المعتقلين الشهداء. دكتور عدنان لا زال معتقل بجثمانه، دكتور إياد الرنتيسي لا زال معتقل بجثمانه. إن شاء الله الزملاء في هذه المؤسسة، أطباء ضد الإبادة وكل المؤسسات الأخرى، أنا متابع كمان في حراك موجود لعدد من المؤسسات، ومن الصليب الأحمر ومن الMSF وعدد من المؤسسات كمان بالتوازي مع هذا العمل اللي بيقوموا فيه زملائنا في أطباء ضد الإبادة. وإن شاء الله تثمر هذه الجهود. الأمر مش سهل ودولة الاحتلال مارقة على القانون، لكن بإذن الله بتكاثف الجهود وتضافرها بإذن الله سيكون هناك فرج قريب. توصلوا السلام والتحيات للوالدة الكريمة ولكل العائلة الصابرة المحتسبة التي تنتظر اللحظة بلقاء بكم إن شاء الله قريبا بإذن الله.
يعطيك العافية دكتور يوسف أبو الريش، وإن شاء الله يا رب نفرح هيك في كل الأسرى وهم طالعين من السجن. وعلى رأسهم الأطباء. ويعني والله يعني صحيح إنه قلوبنا قديش بتعتصر ألم عليهم، إلا إنه الواحد بإيمانه بربه وثقة إن شاء الله إنه إن شاء الله رح يتم الإفراج عنهم في القريب العاجل. وربنا لا يخيب لنا أملا إن شاء الله. وربنا يحفظك يا دكتور، يا دكتور يوسف، وبارك الله فيك.
الله يجزيكم الف خير. الله يعافيك.
الله يعافيك.
الله يخليك. الله يخليكم يا آية. الله يفرجها قريب، وإن شاء الله إن شاء الله راح نقدر نحاول نعمل كل شيء بنقدر عليه حتى ننقذهم ويتم الإفراج عنهم إن شاء الله. خليكم صابرين ومحتسبين، وإن شاء الله الفرج قريب. وشكرا إنكم
إن شاء الله، والنعم
شاركتونا.
بالله. بارك الله فيكم. شكرا
باركتوا صوت
لكم.
الدكتور. الله يخليك، ألف ألف
الله
شكر.
يعطيك الصحة والعافية. بارك الله
الله
فيك.
يخليك، أهلا وسهلا. شكرا يا آية، شكرا يا محمد. خليكم صابرين وصامدين، وإن شاء الله الفرج قريب إن شاء
إن
الله.
شاء الله بإذن الله.
الله يحفظك دكتور نضال، الله يطول بعمرك يا رب.
الله يخليك يا محمد.
سلام للجميع، الله يعطيك العافية.
مع ألف سلامة. Now we're gonna go to the head and the deputy of the doctor syndicate in Gaza. We want to hear from them, their take on the abduction of healthcare workers and their guidance on what we can do as a collective to help them more. I think we have Dr. Raed Hussein with us here. I'm not sure if Dr. Muhammad Hallas joined or not. Muhammad K. Muhammad Kuzais, is Dr. Muhammad with us or no? Or Dr. Raed? Dr. Raed, are you with us? Dr. Raed Hussein.
نعم يا كريم، معك دكتور راد حسين.
أهلا دكتور رائد حسين. So Dr. Raed Hussein, he is the head of رئيس مستشفى
شهداء الأقصى.
شهداء الأقصى.
the martyrs of Al-Aqsa, and he's also the deputy of the Doctor Syndicate in Gaza. Dr. Raed, أهلا وسهلا فيك. Good to hear from you. Please, if you can open your camera, we want to hear your testimony about the current conditions in Gaza and about our colleagues who are being abducted and tortured. تفضل دكتور رائد.
أنا هتكلم بالعربي.
تفضل. دكتور يوسف بترجم لك. خلص دكتور يوسف بترجم لنا كله.
بارك فيكم. بعدين كرامة، هذا تخصص كرامة.
تخصص كرامة وميسة، بس كرامة هي الثانية يمكن مشغول، بس يلا مش مشكلة بنساعدك. أهلا وسهلا دكتور رائد.
حياكم الله سيد، الله يعطيكم العافية.
أهلا وسهلا.
لا شك على بعد مرور سنتين ونص وداخلين على السنة الثالثة من الإبادة التي تمت في قطاع غزة، وكانت الخسائر البشرية الواضحة في خلال الشعب الفلسطيني، وللأسف كان هناك تعمد للاستهدافات للأطباء والطواقم العاملة والعدد الكبير من الأسرى الذي تم أخذه من داخل المستشفيات التي كانت تقدم الخدمات الصحية لأبناء شعبنا خلال فترة الحرب.
دكتور رائد، ممكن تغير زاوية الكاميرا على أساس إنه تظهر في الصورة إذا تكرمت؟ أنا بعذري الكاميرا عندي عطلانة، بس أنت بعينك الله لو غيرت زاوية الكاميرا عشان تظهر صورتك بتكون كويس.
إن شاء الله هيك أفضل، لأنه أنت عارف اللي فيش كهرب، فإحنا الراوتر شغال على البطارية، فإحنا شغالين على إنارة القمر فقط لا غير.
الله المستعان.
الله المستعان. هيك أفضل إن شاء الله.
إن شاء الله.
So Dr. Raed, they have no power. He's working on his battery. That's why the camera is not showing. And again, he is saying that the attack on the healthcare in the last 3 years during this genocide has been very brutal. As you all know, most of the hospitals, the healthcare centers have been attacked and damaged either partially or completely. And the attack against the healthcare workers, with more than 1,700 of them have been murdered, many more have been injured, and a few hundred of them have been abducted and jailed illegally. And there's almost about 95 doctors, nurses, paramedics, and healthcare workers who continue to endure the most horrific condition in Israeli jails. تفضل دكتور رائد.
نعم أخي الكريم. طبعا أنا لن أتحدث كثيرا عن المأساة التي نعيشها في قطاع غزة. أصبحت واضحة العيان خلال الفترة الماضية، وبالأخص نقص هذا العدد المهول من الإصابات والشهداء. وسوف أحاول في كلمتي أن أختصر في ماذا نستطيع أن نفعل. سوف أجتهد في ماذا في طرح عدة نقاط أن نتعاون جميعا لكي نوصل رسالتنا في قطاع غزة إلى العالم أجمع، وأن نطالب بحقوق هذا الكم الكبير من الأسرى على رأسهم الأطباء الأحياء والجثمين المحتجزة حتى هذه اللحظة، حتى نصل إلى طمأنينة هذه الأسر التي يوميا نفقد جزء منها. اليوم وصلني خبر وفاة والد الدكتور ناهض أبو طعيمة المعتقل عند الاحتلال، هو أحد أعيان مدينة خان يونس وأحد المخاتير المميزين في هذه المدينة. اليوم لقد توفي بعيدا عن ابنه المحتجز طرف الاحتلال.
So Dr. Raid is saying that you all know the conditions in Gaza, the horrific conditions after 3 years of genocide, both in the healthcare and the general public, and the complete attack on all aspects of life in Gaza. He's going to focus his talk mostly on what we can do to help together. He was just notified that the father of one of the doctors, his name Dr. Nahid Taima, he's one of the doctors who's been abducted. He continues to be abducted
دكتور
there.
ناهض
His
أبو
father
طعيمة,
just
he is the
passed
head.
away.
دكتور ناهض أبو طعيمة, he is the medical director of Nasser Hospital. He is the medical director of Nasser Hospital.
Oh, wow.
نعم. نكمل حديثنا. يجب أن يكون هناك تحرك عاجل لكافة الأطباء في العالم لكي تصل رسالة هؤلاء الأطباء المحتجزين طرف الاحتلال، وأن تكون الرسائل من هذه الليلة إلى كافة السفارات المختصة بالاحتلال في كافة دول العالم، أنه يجب الإفراج عن هؤلاء العاملين في المجال الطبي الذين تم اعتقالهم من أماكن عملهم، حيث خسر القطاع كثير من الأيدي الماهرة الآن موجود في الاحتجاز. فيجب أن تكون هذه بشكل عاجل تكون النقطة الأولى للانطلاق في سبيل تحرير هذا العدد الكبير من الأطباء والعاملين في المجال الصحي.
شكرا دكتور رائد. Sorry, I lost my connection. I think Dr. Raid mentioned that Dr. Nahid Abu Taima, he was the head of Nasser Hospital. He is also one of the doctors who are being abducted and tortured in Israeli torture camps. They just got notified that his father, who is one of the notable elderly people in the city of Khan Yunis, just passed away, waiting for his son, waiting to see his son, but unfortunately the father just died. His son, Dr. Nahda Abu Taima, who's the head of the Nasser Hospital, continues along with his colleagues to endure all these conditions. Dr. Raid is asking us to send email campaigns and letters to all embassies all over the world that has any connections with Israel, and to the Israeli embassies in these countries to demand the immediate release of the doctors, the healthcare workers, and all the hostages. تفضل دكتور رائد.
هذه النقطة الأولى، وأن تكون بشكل عاجل. النقطة الثانية أن نكون اتحاد قانوني لكي نصل إلى الاحتلال إن كان في محاكمه أو أمام سفاراته في العالم. هذا الاتحاد القانوني يطالب بالإفراج العاجل عن هؤلاء الأطباء، وأن نكني هذا الاحتلال باسم أحد الأطباء الأسرى الموجودين، إن كان الدكتور أخينا العزيز دكتور حسام، أو أخينا العزيز دكتور مروان، أو الدكتور ناهض، أو الأطباء، أو باسم أحد الأطباء. وأن يكون مهمة هذا التحالف القانوني العالمي هو الدفاع عن أطبائنا المأسورين والمحتجزين طرف الاحتلال والإفراج عنهم بشكل عاجل.
So the first call was for immediate and urgent letter and email campaign and call campaign to all embassies all over the world that has any relationship or impact on Israel. The second call is to establish a global legal coalition of lawyers and legal experts all over the world to take the cases of these doctors, healthcare workers, and to defend them uh, in Israeli courts and to represent them on the international forums too. So the call for a legal coalition of volunteer lawyers or lawyers, legal body to defend and to represent our colleagues. That's the second call. تفضل دكتور رائد.
النقطة الثالثة أن يقوم هذا الاتحاد القانوني بمخاطبة كافة دول العالم التي رأت المجزرة بأم عينيها على مدار الثلاث سنوات الماضية، وأن نخاطب الحكومات بالتدخل العاجل للإفراج عن هؤلاء الأطباء وهؤلاء هذه الكوادر التي تم اعتقالها. إن لم تستجيب دولة الاحتلال فيجب علينا أن نطالب كل الدول الحليفة وكل دول العالم بالإفراج العاجل والضغط الدولي من خلال الحكومات للإفراج عنهم.
Dr. Raid is also suggesting that this legal body should be tasked to approach all governments in the world that has been silent and complicit and watching this unfolding genocide for the last 3 years, to pressure their governments to do something about it, to bring an end to this genocide after 1,000 days, and to demand the immediate release of these doctors and healthcare workers, and all the hostages need to go home, which was the call from the other side, and the Palestinian people are no less, and all their hostages should come back home, and this legal body should use all its influence with these governments to ensure and to pressure to that end. تفضل دكتور رائد.
النقطة الرابعة، نحن كنقابة جاهزون لكي نشارك أي اتحاد صحي أو أي نقابة في العالم لكي نضع الآليات والمؤتمرات الصحفية والتدخل الإعلامي لكي نوصل رسالتنا في سبيل مساعدة رفع الظلم عن شعبنا الفلسطيني، وبالأخص عن هؤلاء الأسرى في كافة دول العالم. ما نستطيع أن نقدم ونحن جاهزون على مدار الساعة، ما نستطيع أن نقدم، نحن على استعداد. نعم.
The fourth point is Dr. Raid is saying that the doctor syndicate in Gaza is ready to join forces with every and all medical and healthcare institutions around the world to build a coalition again with the same demand of ending this genocide, ending this atrocity, and demanding the release of the hostages, the doctors, and the healthcare workers. So maybe we need to brainstorm this further and try start building this coalition led by the doctor syndicate in Gaza, and have medical and healthcare organizations all over the world to join this coalition to amplify their voice and to have or create a powerful medical and global coalition of to pressure their governments to do something about what's happening. تفضل دكتور رائد.
النقطة الخامسة والأخيرة، يجب أن يعلم بعد أن انتشر خلينا نقول القضية الفلسطينية في خلال الثلاث سنوات، تغير محورها وأصبح رأي العين الظلم الذي يقع على شعبنا الفلسطيني. فنحن ككوادر صحية كنا نتمنى أن يكون لدينا ترابط مع كافة الكوادر الصحية الموجودة في كافة أنحاء العالم لكي تصل الصورة الحقيقية للواقع الذي يدور الآن في قطاع غزة صحيا، وهؤلاء الأطباء ما هي كانت مهمتهم داخل المستشفى وكيف تم اعتقالهم. هذه هي رسائل يجب أن نوصلها من خلالكم بالطريقة التي ترونها مناسبا، مكتوبة أو مقروءة أو بالفيديو، حتى يعيش الناس أو يعيش الأطباء زملائنا المتواجدين، ويعيش الأطباء الأحرار الذين استجابوا لندائنا. ونشكركم على هذا اللقاء لكي نوصل رسالتنا، وأن نستمر في هذه اللقاءات لكي تصل رسالة بشكل كامل لكافة أطباء المتواجدين في أنحاء العالم المشاركين معنا، لكي نستطيع أن نوصل من خلالهم رسالتنا، وأن يكونوا سفراء لأطبائنا الفلسطينيين الموجودين في قطاع غزة والأسرى طرف الاحتلال.
Shukran. So, Dr. Raed, the last appeal is for all doctors, healthcare workers, individuals, and organizations all over the world to reach out to the doctors and healthcare individuals and institutions and the syndicate in Gaza to support them, because our colleagues in Gaza have been enduring the unimaginable in the last 3 years. They have been trying to survive under the most horrific conditions ever recorded in history. And they really need the help and the support from every healthcare worker and every medical organization in the world. Please reach out. Please provide support. Please share their message. Please send their message. Unfortunately, most of the major medical organizations all over the world have been silent on this. Many of them have been complicit or even supportive of the other side. This should not continue to be the case. It is upon all of us to try to do more, to reach out to our colleagues in Gaza, try to be there for them, try to support them in any way we can, and also to be their voice, because they are in very desperate situation now. We know that Israel continues to attack the healthcare workers and institutions, continue to deny the entrance of medications, health-saving aid, medical supplies. There is a shortage of doctors, shortage of nurses, shortage of fuel, medications, water, and everything. And they do need our help. And this is a call for everyone, any human being, any doctor, healthcare worker who went to school to save humanity and to be there for humanity, to do more. Shukran, Dr. Raed.
عفوا نشكر اللقاء المميز، وإن شاء الله أن يكون له من النتائج أن تصل إلى كافة أنحاء العالم. حاولنا في نقابة فلسطين أن نقوم بعدة فعاليات داخل قطاع غزة، ولكن لم تكن بالمستوى المطلوب، لأن هناك حصار إعلامي وعدم قدرة على الصدور إعلاميا بشكل مناسب. لكن نتمنى أن تكون أنتم سفراءنا للعالم ونستطيع إيصال صوتنا. وبارك الله فيكم على هذا الجمع، ويعطيكم العافية، ومشكورين جدا.
أهلا وسهلا دكتور رائد، شكرا لك، شكرا على صبركم وثباتكم وصمودكم وإنسانيتكم، وشكرا لكم أنكم أفضل سفراء لنا، وأنتم قادة القطاع الطبي في العالم كله، وأنتم من القادمون على الجمر رغم كل الظروف. دكتور يوسف come please.
Yeah, actually, I want to mention some words about Dr. Nahad. Again, Dr. Nahad, he was the head of Nasser Hospital. And when the occupation started to siege the Nasser Hospital, he refused to leave. He continued to manage the patients. They invade the hospital, and he was arrested inside the hospital. At that time, and after they finished the invasion of the hospital, we found a mass grave. It was containing 350 killed people there. 150 were from the people who were inside the hospital itself. And Dr. Marwan, Dr. Nahad, as I mentioned, he refused at that time to leave, and he continued to work, although he was have the same faith when he compared himself to the other doctors and the other head of the hospital. He was 100% sure he will be arrested, but really he have a soft decision to continue managing the cases. I want to mention another point. While he was inside inside the prison, and some of the released people and the released staff, they mentioning that Dr. Akram Hussein, he's another surgeon. He was inside the prison again with Dr. Nahid. He was with severe cellulitis and a huge amount of pus. Unfortunately, the incubation doctors at that time, they refused to manage him, and they wait till finally they have a small container of yogurt, and they use that container just to have an incision to drain the abscess. Unfortunately, they saved the hand of Dr. Akram Hussein. So Dr. Nahid, he continued his mission and his practice of medicine, even inside the prison itself. So that's Dr. Nahid. So it's not only Dr. Hussam and not only Dr. Marwan. All the doctors, they have the same story. They have the decision to continue their mission and to continue their work and the humanitarian effort to support the innocent people. And unfortunately, they were blamed or they were punished because they have a such decision.
Thank you, Dr. Abu Rish. Shukran. I think maybe
We
we
have Dr. Muhammad Hallas, he's also drama.
نعم.
We have Dr. Muhammad Hallas, the head of Doctor Syndicate in Gaza also.
Okay.
Dr. Muhammad, are you there with us? Dr. Muhammad?
I'm calling him right now. Sometimes the net goes and comes.
السلام عليكم.
وعليكم السلام، يا أهلا دكتور، تفضل.
الله يعطيك الصحة دكتور نضال، كيف حالك؟
الله يخليك، الحمد لله، تفضل دكتور، أهلا وسهلا.
أنا أول شيء بشكركم على جهودكم في هاي المؤسسة صراحة، أو الفريق العمل. لا شك إنه الهموم تجمعنا، والحدث كبير بالنسبة لموضوع الأسرى.
لو سمحت دكتور محمد قزيز, can you translate for him please? My connection is not great. Can you Muhammad
Yeah, sure
translate for
thing.
Dr. Muhammad? Yeah, go
Sure,
ahead.
sure.
تفضل.
So this is Dr. Muhammad Hendes. He's the head of essentially the Doctors Committee, the registry for all the doctors in Gaza. He said, first and foremost, he just wants to thank Doctors Against Genocide and this organization for bringing attention to this important matter and for the amazing work we do. تفضل دكتور.
طبعا موضوع الأسرى الفلسطينيين اللي هم موجودين لدى الاحتلال للأسف، لا شك إنه من المواضيع المهمة والمهمة جدا، لكن للأسف طريقة التعامل لحتى الآن نفس الأسلوب ونفس النهج اللي بتتبعه معظم المؤسسات الدولية والمحلية خلينا نقول العربية. في نفس الوقت الجانب الإسرائيلي ما براعي أي جزئية من الجزئيات اللي هي الحقوقية، سواء على مستوى القانون أو القانون الدولي أو أي شيء من هذا القبيل. يعني هو ما بيفهم غير اللغة اللي موجود عليها، يعني خلينا نقول. ولذلك أعتقد إنه إحنا على جميع المؤسسات المحلية تبعتنا إنها تغير شوية من النهج تبعها، يعني بمعنى.
So he's saying that what he knows about the organization, what we've done in the past, has been very consistent with what all the other aid groups and organizations have tried to do, specifically regarding the question of Palestinian prisoners. Unfortunately, that has not had an effect on the Israelis, and the Israelis do not respect any human rights or any laws regarding the treatment of the hostages. And so ultimately we have to come up with a new strategy.
بالنسبة لطريقة التعامل، أعتقد إنه الوقت ليس لصالح الأسرى. الوقت ما كان لصالح الأسرى فقط للأحياء أو لدكتور حسام أو لدكتور مروان يا أخوان، أو حتى جثث الأسرى اللي موجودين عنده هو ما سلمهم، عفوا هو لا سلمنا لا جثة الدكتور عدنان ولا جثة الدكتور إياد الرنتيسي. وهل هم بشكل خطر عليه؟ لا طبعا، ولكن يعني الرؤية اللي أنت بتتعامل فيها مع هذا العدو إنه حتى جثث أطباء ليس لديهم أي علاقة وتم اعتقالهم، خلينا نقول في أثناء عملهم، وهذا مخالف لكل القوانين الدولية. حتى جثثهم وإكرام الشارع الفلسطيني أو أسرهم وعائلاتهم بدفنهم ما يليق بدفنهم، يعني خلينا نقول الدفن الكريم هو منع عنهم ذلك.
So people understand the context and the importance of this. Regarding the hostages, time is of the essence, because There is no respect for the living hostages, and so far their transgressions that even the people who have died in captivity, they have not gotten their bodies back yet. Dr. Ahmed Al-Antisi, Dr. Adnan Al-Bush, their bodies have not been returned. These are people who were kidnapped at their work, and they've still now been denied the dignity of a pure burial with their family.
التعاطف مع موضوع الأسرة، خلينا نحكي وللأسف، يمكن أنا بشاهد إنه في شوية بعض الدول الأجنبية أكثر من دولنا العربية أصبحت تتعاطف مع قضية غزة بالدرجة الأولى. أصبحنا يعني أنا بحكيها بصراحة، يعني حتى يعني أشبه برفع العلم الفلسطيني. يعني لما إسبانيا رفعت العلم الفلسطيني، إحنا إجينا فيما بعد ما إسبانيا رفعت العلم الفلسطيني رحنا نرفع العلم الفلسطيني في بعض دولنا، وإن كان يعني في تحفظ على هذا الموقف. موضوع الأسرة، أعتقد إحنا لازم نغير النهج. النقابات العربية للأسف في غيبوبة، هذه حقيقة، يعني سواء على مستوى نقابة أطباء مصر، نقابة أطباء الأردن، النقابات العربية جميعا، نقابة أطباء الجزائر، المغرب، الوطن العربي، تواصلنا مع الجميع، ولكن لكل أسف وبكل أسف ما زالت معطلة بالكامل. إحنا في قطاع غزة، عفوا، يعني بدنا ننتظر منا إنه إحنا نقوم بموقف. إحنا اليوم الجهات الإعلامية ما بتوصل الصوت الكامل لقطاع غزة إلى الخارج. قبل لحظات يا اخواننا، قبل لحظات الناس تعتقد انه احنا في حاله سلم او في حاله هدنه. ما قبل لحظات في عنا شاهدين الان خلال الساعه الاخيره عند مفترق السامر، وفي عنا 2 شهداء. يعني يوميا الشهداء تسقط، يوميا القصف ما زال على قطاع غزه، يوميا المناطق الحدوديه تشهد اشتباكات وتقدم. كل هذا، والعالم يعتقد انه احنا في حاله، زي ما بيقولوا في حاله هدنه. احنا لا، مش في حاله هدنه يا اخواننا، مش في حاله هدنه. هذه زي بيسموها بعرف السياسي قص العشب. هم دمروا في قطاع غزه الكثير، ولكن الان هم بيشتغلوا على سياسه قص العشب، يعني جز العشب، يعني اي عشبه تظهر بده يتم القضاء عليها.
بس دكتور ترجمان. And so sadly, even Arab countries and their medical associations and their countries, they've actually been worse than some of like more foreign European and outside countries. That even amongst the Arab nations, he noted comically that they only started, raising the Palestinian flag after Spain did as well. And so they've reached out to the different medical associations of Egypt, of Jordan, of Qatar, of Saudi Arabia, trying to appeal to get physicians and healthcare workers from that area to also do, advocacy for Dr. Hussam. But so far, there's been no solution. And it's not only, in regards to the prisoner situation, even trying to get them to uphold the ceasefire. He said that they claim every day there's a ceasefire, but right now, just less than an hour ago, he received news that there was a bombing at Roundabout, and there's 2 shuhada already.
طبعا انا من خلال الموقف اللي هو انذكر، من خلال اللي هو المحامي الدكتور حسام ابو صفيه، لا شك انه الوضع خطير، ونقله لسجن اخر، سجن الرمله، ويعني يبدو انه في شيء حقيقي قاعد بتجهز. ولو استشهد حتى الدكتور حسام، فكر كل عالم يعني بده يتحرك كثير. عفوا، يعني سؤالي يعني هذه يعني فقط عليه علامة استفهام. يعني لو جاء خبر انه استشهد دكتور حسام، يعني الجهات الإعلامية حتظهر أول يوم، وبعدين ثاني يوم سيكون في طي النسيان، يعني للأسف الشديد.
ثاني بس ترجمة دكتور. And going back to the situation of the prisoners, and specifically Dr. Hussam Abu Safiya, the news that we heard from his lawyer that he was moved, that he's in critical condition, that he was moved to another prison, it seems like they're preparing for something. They're preparing to do something to him. And so even that, it is hard to say, but even if, the worst situation happens and he is martyred in prison, do you think that, right now where we're at, that the world is going to stop for Dr. Hussam Abu Safiya, that, things are going to change because and for Dr. Hussam Abu Safiya, the news will mention him that same day, and then things will continue on as they are?
طبعا خلينا نعمل تجربة ولعلنا ننجح بها. أنا بقترح يعني إنه إحنا من باب التغيير علنا ننجح يعني، ونوصل رسالتنا للعالم. ندعي ليوم، نحدد يوم من الآن في الجلسة هذه، نقول مثلا خلينا نفترض إنه كمان أسبوع وقفة في جميع مستشفيات، خلينا نقول وطننا العربي ومساندين إلنا في مستشفيات العالم بساعة معينة، إنه نقف لمدة ساعة. هذا اقتراح أنا جاهزين له في قطاع غزة، لأنه إحنا قبل هالمرة عملنا وقفات زي هيك وبلغنا، ولكن يمكن إحنا المفروض العالم يسمع صوتنا لما نقول إنه إحنا بندعو إلى وقفة. إحنا حتى لو وقفنا 10 جيد منا، لأنه إحنا منهكين يا أخواننا، لكن إحنا على الأقل نحدد يوم، خلينا نشوف ونقول للمستشفيات الوطن العربي في مصر، في الأردن، في الجزائر، في المغرب، في أحرار العالم اللي موجودين، عشان يعني نشوف الحقيقة، هل إنه فعلا نستطيع إنه إحنا نشكل في ساعة معينة وفي دقيقة معينة إنه صوت هذا يصل. حتى أنا كمان معني كمان بمستشفيات إخواننا في الضفة الغربية المنشغلين يعني عنا كثير يعني بأمورهم يعني، ولكن إحنا نجد لهم عذرا في مستشفيات القدس. ندعي جميع النقابات، أنا يعني حندعيهم ونتمنى انه ننجح في هذا الاطار. ممكن تساعدونا في هذا الشيء كحلقة وصل. نحدد يوم من الآن، نفترض ان احنا نقول مثلا يوم 15/7 الساعة 10 صباحا لغاية الساعة 11 صباحا، على الأقل نكلف أنفسنا بوقفة اعتصام لأجل جميع الأسرى الأطباء والكادر الصحي لخروجه من زنازين الاحتلال. إذا
Sorry, but there's one, Doctor. So, Dr. Hendes has a proposal they wanted, and we'll see if it works, because there's been a lot of we haven't gotten necessarily the support that we need to make this happen, and especially from Arab nations as well, and it hasn't been as coordinated. And so he was saying he suggested doing, like, if we plan ahead, suggested doing a work stoppage or a timeout or a moment of remembrance for an hour across all the countries of the world at the same time, and especially in the Arab countries. He said that they are ready to do this in Gaza. They've done this in the past before, and they get even as low as like 10 doctors have stood up all and tried to coordinate everything, but they're so busy in Gaza that they that they can do this, but they need the global support and everybody else doing it at the same time. Especially the Arab countries, especially the people in the West Bank, and all the free people and healthcare workers in the world, all at one coordinated time. Take some time out to call and bring attention to the release of the release and protection of their colleagues. تفضل دكتور.
قد تكون هذه الفكرة وإن كانت بسيطة قد تؤثر على الاحتلال. أنا متأكد يعني حتى لو الأمور بسيطة لكنها حتكون قادرة على إحداث فرق في ملف الأسرى اللي هم وبالأخص الأطباء منهم في سجون الاحتلال.
And I know this may seem like a simple idea, but I feel strongly that if it's all coordinated together, it will have an impact. It's bound to have an impact on the prison authority and the situation of the hostages. Yeah.
طبعا أنا بشكركم. يعني يمكن هذه في الفترة الحالية أعتقد هي من النقاط المهمة. أعتقد إنه إحنا لازم نسرع في عملية الوقوف، وبالأخص عشان الدكتور حسام، لأنه أعتقد إنه الوقت ليس لصالحه وليس لصالح الدكتور مروان ولا لجميع الأسرى، ولكن يمكن هذا أقل شيء إحنا ممكن نقدمه انه نعمل الوقفه هذه ويكون بالتزامن العربي والدولي في جميع اللي هي المحطات على قدر على يعني في وقت معين يتم تحديده، ونشوف ايش مدى الضغط اللي ممكن احنا نكونه ضد الجانب الاسرائيلي في هذا الملف.
يا شكرا. شكرا دكتور محمد. I agree with this. احنا last night actually we were talking about something similar to pick a date and preferably July 15th and call for a global medical stand with our colleagues, the doctors, the healthcare workers in Gaza. We can do it, as you said, for 1 hour for all the medical community all over the world. Invite everyone to make this stand for 1 hour to bring up the issue of the doctors, the healthcare hostages. And in the meantime, this week, we call upon everyone to start a letter campaign, a call campaign, building up to that July 15th global medical and healthcare hour that we can escalate progressively if there is no response to our demands, and make it 2 hours the next week and 3 hours until every doctor and healthcare worker is safe and back to their families and back to their patients, because we need that. These are one of the few of the most experienced doctors, healthcare workers, and their patients, their families, their communities need them. So that's really a great call, a unifying call that we can start organizing and preparing for July 15th. We can start with 1 hour and we can escalate every week until our demands are met. So thank you for the idea, and inshallah it's gonna be something that we can organize and brainstorm soon. We have also Dr. Muhammad Abu Salmiya, none other Dr. Muhammad Abu Salmiya, the head of Al-Shifa Hospital. I don't know, Dr. Muhammad, are you with us? Dr. Muhammad Abu Salmiya? Dr. Muhammad Hallas just shared with us this idea from the Doctor Syndicate. Dr. Muhammad Abu Salmiya himself was abducted and was tortured and treated inhumanely for more than 7 months, I think, and he would be actually a great person, a witness to share with us the conditions that they endure when they get abducted there. Dr. Muhammad, are you with us? Dr. Muhammad Abu Salmiya. I see he's on the call, but Dr. Muhammad Hallas, any final call, any final suggestions, please?
يعني في ما بعتقد انه هو وقته انه احنا لازم نقدم مساعدات لاسر الاسرى اللي عندنا يكون في عندنا برنامج ثابت لهم. احنا حكينا يمكن مع عدة مؤسسات لرعاية أسر الأسرى اللي هم موجودين عندنا. عددهم طبعا 18 أسير، 16 أسير أحياء، وعندنا 2 اللي هم أسرى هم أحياء عندنا ولكن هم مستشهدين لدى الاحتلال، وبالتالي هم عددهم 18 أسير موجودين. أسمائهم لديكم جميعا. أعتقد أنهم هم بأمس الحاجة، هم مش ممكن ما يطلبوش منكم مساعدة، ولكن هم فعلا بأمس الحاجة لمساعدتكم. جزء كبير من هذول الأطباء هم برعوا أسرهم، أهاليهم، غيابهم عن يعني لمدة طويلة 2 وأكثر عن أسرهم وعائلاتهم. يعني زي ما بيقولوا غاب الراعي، راعي الأسرة أو رب الأسرة. عشان أكون أمين معاكم عملنا لهم صفحة خاصة عندنا في النقابة. بسمع كثير لمشاكلهم وقصصهم صراحة. للأسف ليس لديهم القدرة أنهم يطلبوا زي باقي الناس، يعني خلينا نقول اللي بيسعوا شو اسمه. حتى جزء منهم طلب منا عمل، انه احنا ما بدنا يعني حدا يعني من عفة النفس انه يساعدنا بمساعدات يعني عينية او كذا امور زي هيك. شغلونا او لاقوا لنا فرصة عمل احنا نشتغل ونعيل او ابنائنا يعني. طبعا هذا النهج للاسف احنا اليوم في قطاع غزة في صعوبات والله شديدة جدا جدا. يعني هي مثلا في لجنة القلب انا موجود فيها. القسطره القلب بتتقف، فيش مواد قسطره، يعني محاصره غزه يا اخواننا. غزه محاصره حصار شديد جدا جدا. وزاره الصحه هاي الدكتور يوسف موجود، للاسف منهاره من عامين، منهاره مش من اليوم يعني. عفوا، ما يعني ما بنقدر نجمل انفسنا ونقول انه احنا صح واقفين على اقدامنا شويه، بس احنا في يعني الوضع جدا سيء على كل المستويات يعني.
Shukran,
Uh,
Dr. Muhammad. So, Dr. Muhammad is also saying that these abducted doctors and healthcare workers, the 18 doctors, 16 of them alive, two of them have been murdered, and their bodies still detained. Their families were dependent on them, and since their providers, the family providers, their bread winners have been abducted. These families, they do need help. They do need support. They usually do not ask for help, but they are in dire need. The Doctor Syndicate has been trying to get their data and try to support them, but it's been hard. They are calling on all of us to support their families while we are working to release them. He's also sharing that the healthcare system in Gaza is collapsing. It's been under constant attack for more than 3 years, and things are getting really, really bad. We really need to do everything in our hand to end this genocide, this attack, open every crossing, open every way to get aid, to get medical supplies, to get medication, to get fuels, to get support to the people of Gaza and the healthcare system in Gaza before a final or a complete collapse. So, shukran, Dr. Muhammad.
شكرا لك يا دكتور نضال.
الله يخليك. بعرفش دكتور محمد ابو سلمية. Are you with us, دكتور محمد ابو سلمية?
Yes, Dr. Nidal. Yes.
اهلا
That's
وسهلا.
good.
Dr. Muhammad Abu Salmiya is the head of Al Shifa Hospital. He himself has been abducted and was in jail. I'm not sure about the date. Was it 7 months or 10 months?
7 months and 10 days.
10 days. And actually,
Seven months and 10 days. Yeah.
last week was the anniversary of his abduction or his release. So please share with us, please, Dr. Muhammad. You know
Okay.
better than anyone else because you have been through this experience yourself. Tell us what these hostages go through, the amount of torture, the amount of inhumane treatment, and what do you think? What else we can do to help them and bring them to safety and bring them to freedom? تفضل.
Okay, Dr. Nidal. I will speak in Arabic. Dr. Nidal, I will translate. Thank you. الآن طبعا أنا بدي أتكلم مختصر صراحة. يعني الآن الكوادر الطبية في الفعل في المعتقلات الإسرائيلية، وأنا كنت جزء من هذه الطواقم، كانت تتعرض لاعتداءات وتعذيب أكثر من الأسرى العاديين، وهذا كان ملاحظ بشكل كبير في كل الطواقم الطبية اللي أنا التقيت فيها. يس دكتور نضال. دكتور نضال.
نعم تفضل سامعني.
نعم.
يا أنا سامع.
فبتكلم عن
سامعني؟
الآن سامعك. أوكي. يس.
ترجمة.
يا.
So Dr. Muhammad said that the abducted healthcare workers and doctors usually receive more harsh treatment and more torture than regular hostages. And it seems they do this on purpose to break their spirit and to make them a lesson for other healthcare workers. تفضل.
يعني عندما تم قتل الدكتور إياد الرنتيسي، وكنا هذا بشهر تقريبا ديسمبر 2024، وكنت في معتقل عسقلان، يعني تم وضع صورة الدكتور إياد الرنتيسي على الشاشة عنده على المحقق، وقال لي بالحرف الواحد: سأقتلك كما قتلت الدكتور إياد الرنتيسي. يعني قمة الانحطاط وقمة العنجهية وقمة الإجرام كان.
So when Dr. Iyad Rantisi was murdered in prison, the interrogator brought the pictures of the murdered Dr. Rantisi and showed it to Dr. Abu Sulmiya when he was also in jail. And he told him that I'm going to kill you like we killed Dr. Rantisi if you don't give us everything we want. تفضل.
المشكلة دكتور نضال برضو كمان الطواقم الطبية والتمريضية اللي كانت تتعامل من الجانب الإسرائيلي مع السجناء. كانوا عبارة عن سجانين، وكانوا عبارة عن يعني معذبين، وليس ممرضين أو أطباء. وهذه كانت مشكلة. كان عندك الأسير، كان الطبيب أو الممرض أو حتى الأسير العادي، عندما يشعر بشيء من الألم يعني يضل كاتم ألمه ولا يروح على الطبيب، عشان والله إنه في مسافة ما يروح على الطبيب حيتعذب بزيادة. فتخيل أنت تكون المنظومة الصحية داخل السجون الإسرائيلية عبارة عن أداة تعذيب وليس أداة، يعني كما فكرتها كل الشرائع الدولية أنه الأسير الآن أصبح في قبضة الاحتلال، فبالتالي من حقه أنه يقدم له العلاج. فصار جزء من التحقيق هو منع العلاج والتعذيب أيضا، والضرب على الجروح والضرب على الأماكن الحساسة للطواقم الطبية المعتقلة داخل المعتقلات الإسرائيلية.
So this
ألو.
is a
Nidal, I
very
think your connection is bad.
important testimony that Dr. Muhammad is sharing, that the doctors and the healthcare workers in Israel, in the Israeli prisons, they were themselves participating in their torture, not providing them the enabling the continuation of the torture of the hostages and the detainees.
يعني الآن يعني في يوم من الأيام أنا بذكر جمعونا 5 أطباء أو 6 أطباء في سجن عوفر، وكان من ضمنهم الدكتور أكرم أبو عودة، ودكتور غسان أبو زهري، ودكتور المقداد. جمعونا في هذه الغرفة وحدنا وقالوا لنا أنتم الآن عبارة عن إرهابيين وليس أطباء، ويجب عليكم ألا تتعاملوا مع الأسرى بأي شيء من الأشكال، ولا حتى بالأدفايسز، حتى يعني النصائح للأطباء ممنوع مع الأسرى ممنوع تتكلموا. ويعني في يوم من الأيام يعني أنا اعتدوا علي اعتداء بالليل في سجن عوفر، وتم تكسير يعني يدي، وتكسير 4 من أضلاعي، والدماء تسيل من رأسي بشكل كبير، فقط لأنني مدير مستشفى الشفاء. وكان ليلة عصيبة جدا، كنت أنا أفقد حياتي فيها وأغمى علي في هذه الليلة.
So Dr. Muhammad is sharing that he remembers one of the incidents. They gathered 5 or 6 of the Gaza doctors who were abducted there, and they put them in one room, and they start threatening them and demanding that they do not talk to the other prisoners, do not provide any medical advice, that they are being treated now as terrorists, not as doctors anymore. They need to forget that they are doctors. They are terrorists now. And if they try to help or provide any medical advice to any of the prisoners, they will be punished for it. He also records one of the worst nights that he endured during the prison. He sustained constant torture and beating all night long. They broke both of his hands. They broke 4 of his ribs. He was hit on his head. He was bleeding all over his body, and he felt he will die, and he ended up collapsing under the constant beating and torture, and he thought that he would lose his life. تفضل.
يعني عشان هيك صراحة لازم ناخذ يعني التصريحات اللي طلعت من المحامي تصريحات جدية عن الدكتور حسام أبو صفية، عن الدكتور مروان الهمس، وعن الدكتور غسان أبو زهري. غسان أبو زهري في يوم من الأيام كان يفقد رجله نتيجة سلولايتس، أنا شاهد عليها 3 أسابيع لم يعالج. فبالتالي هناك فعلا يجب أن نأخذ هذه التصريحات من المحامين تصريحات جدية، أن هناك خشية حقيقية على هؤلاء الأسرى الأطباء، ويمكن فعلا أن نفقدهم. نحن نريد هؤلاء الأطباء أن يكونوا بيننا، لا نريدهم يعني شجعانا وأبطالا عندما يستشهدوا، نحن نريدهم أحياء والعالم يتكلم عليهم وهم أحياء، لا نريدهم بعد أن يستشهدوا أن يصبحوا أبطالا، هذا ما نريده. لذلك يجب بالفعل يعني ما تحدثتم به، أن يكون هناك وقفات، أن يكون هناك دعوات، وأن يكون هناك بث مباشر، وأن يكون هناك فعاليات كبيرة جدا لهؤلاء الأسرى، لأنه بالفعل هذا ما يحدث داخل الأسر، وأنا كنت جزء من هذه المنظومة وهذا التعذيب الذي كان يحدث.
So Dr. Muhammad Abu Safiya is urging all of us, again, urging all of us to take these threats that the lawyer of Dr. Hussam shared seriously. Dr. Muhammad himself was there, and he is a witness to this. These are true. They are torturing them. Their life is really in immediate danger. We should take their threats seriously and act accordingly. These doctors, these healthcare workers, these hostages' lives are in immediate danger. We need to do everything we can to try to save them. He mentioned another story of Dr. Ghassan Abu Zuhri, who is also a well-known orthopedic abducted from Nasser Hospital. He himself saw him having cellulitis, skin infection in his legs that went on for a long time without any treatment. And he himself, his life was under immediate danger. And again, to reiterate that the doctors, the nurses in these prisons, the Israeli doctors and nurses are part of the torture campaign. They are enabling the torture. They are withholding care, and they are allowing and enabling the torture of these doctors. And again, to say it again, Dr. Abu Salmiya is urging all of us to take these threats on the lives of these doctors very, very seriously. They are real, they are happening, and their life is in immediate danger. تفضل دكتور محمد.
يعني بالتاكيد هذا ما يعني انا بديش اطول عليكم كثير لانه انا شايف الوقت تاخر شوي، ولكن لازم ناخذ موضوع الاطباء والممرضين وجميع الاسرى. انا عندما خرجت من السجن صرحت وقلت ان الاسرى الفلسطينيين لم يتعرضوا للتعذيب منذ النكبه، والان ما يجري في السجون الاسرائيليه هو عباره ليس تعذيب، هو قتل ممنهج. الكل خسر. انا خسرت من وزني 30 كيلو جرام، وكل الاسرى الذي كانوا معي اقل واحد خسر من وزنه 30 كيلو جرام. لا يوجد نظافه شخصيه داخل السجون، لا اكل، لا طعام، لا شراب، لا نوم. الضرب في كل ساعه، في كل دقيقه، في كل ثانيه. فبالتالي يجب أن تضع هذه على الطاولة الجميع المنظمات الدولية والحقوقية ونقابات الأطباء في العالم، وكل العالم يجب أن يتحدث عن هذا الموضوع، لأنه فعلا هذا ما يجري. هذه ليست يعني بروباغندا نريد إخراجها للعالم، هذه حقيقة وفاكت كنا وعشناه، وأنا عشته، والدكتور غسان أبو زهري عاشه، والدكتور أكرم أبو عودة عاشه، والدكتور أكرم حسين عاشه، وكل الأطباء عاشوا هذه المأساة المستمرة التي لا زالت. والذنب الوحيد الذي اقترفه هؤلاء الأطباء فقط أنهم أطباء بقوا مع مرضاهم ومع جرحاهم لآخر ثانية. هذا هو الذنب الوحيد الذي اقترفه الأطباء. لذلك أنا بشكركم جدا على الاستضافة، بشكركم جدا على هذا الموضوع، ويجب أن يتم تسليط الموضوع عليه في كل يوم وفي كل دقيقة وفي كل ثانية. شكرا لكم.
شكرا دكتور محمد. Again, Dr. Muhammad is urging all of us to do everything we can. He said that Israeli prisons have never been a great place, but in the last 3 years, they have become a torture camps, a systematic campaign of killing and murder. The lives of the doctors, the healthcare workers, and every hostage, more than 9,500 of them, is in immediate danger. He is thanking all of us for raising this issue, and he is appealing to all of us to try to do more to save them. We don't want to lose the lives of our colleagues, the healthcare workers or the hostages. We don't want to make cases of heroism. We need to intervene immediately to save their lives. It is not the time to do some PR campaign. This is not propaganda. This is real. This is an imminent threat. This is an immediate threat. This is the time we can intervene, do everything we can to save them, or it will be too late. And this is a call for every human being all over the world, every human being of conscience, every doctor, every nurse, every paramedic, every healthcare worker. Now is the time to save your colleagues. Now is the time to do everything you can. And I know we did a lot, but we can do more. I know I myself can do more. I can make 100 calls a day. I can make 100 letters a day. I can send 100 emails a day. Let's talk about the July 15th for a global call for global medical healthcare worker campaign all over the world, at least to honor them with 1 hour of standing with our colleagues, that we can escalate every week into more time unless our demands are met and until our colleagues are free and safe back to their families. back to their patients, and back to their communities. Shukran, Dr. Muhammad. Thank God for your safety. Thank you for your testimony. Alhamdulillah ala salamtak
شكرا.
وألف شكر
Thank
لك
you.
والله يعطيك ألف عافية.
Thank you for
By
having
the
me.
way,
Thank you.
by the way, just to tell you how important it is to release these hostages, the doctors, the healthcare workers. Dr. Muhammad was there under torture, under inhuman condition for 7 months and 10 days. And immediately after he was released, he went back to Al Shifa Hospital and back to work immediately. And he's been working day and night to try to rehabilitate and to rebuild whatever they can in that hospital to provide care for the communities that need their care. Every healthcare worker, every doctor who is being abducted now, who's being tortured, is a very skilled human being, a very skilled professional that can help their community. We need them to be released, not just for their safety, but also because their communities need them. And Dr. Muhammad Salfiya is the best example on this. I know we meet with him. We have many projects with him as Doctors Against Genocide. We work with Al Shifa, and we know he works day and night. And he is, despite all the difficulties, despite all the limitations, despite the fact that no supplies, no medications, no rebuilding material is allowed in, they are doing all they can. And they managed to rebuild almost 300 beds at Al Shifa Hospital after this hospital was destroyed twice. And they're working day and night to open more, departments there. I know they're rehabilitating the emergency room building at Al Shifa. And we are honored as Doctors Against Genocide to be part of this effort. And this is going to be open to the public to provide care in the next few weeks. They have been working on the field hospital there, and that work is also almost complete. In a few weeks, it will be open and providing services for people. And as Doctors Against Genocide, we are proud to be part of this, but there are many other partners, many other organizations that are helping. And most importantly, it is our colleagues, Dr. Muhammad Abu Safiya, Dr. Yusuf, their colleagues, the doctors, the nurses, the paramedics, the engineers, the maintenance people. They are working day and night, despite the lack of everything, to make things work and to provide the minimum they can do. Fadal Ikram.
Thank you. A lot of the listeners on the webinar are sending suggestions, questions, and very good ideas. If you have any media contacts, if you have any connections with people that might be useful for this campaign, please write an email to the media outlet or to the person that you would like to engage on this. Copy info at Doctors Against Genocide. We want to uplift the voices of our colleagues in Gaza. Once we make connections, it's very important that the world hears from Dr. Abu Salmiya, from the family of Dr. Abu Safiya, from the family of Dr. Alhams. So please send us whatever you can do, whatever thought, ideas you have. And I know there are fantastic ideas in the Q&A. Put it in an email and we will make it happen. We can do this together. We do need a lot of help in this. And just like Dr. Alhams said, this should be on the lips of everybody, and every ear in the world should hear this. It is actually ridiculous that we, Doctors Against Genocide, are probably one of the only organizations or one of the only outlets that you can hear about this every week. Every media outlet should be engaging in making this the talk of everyone, because this level of cruelty, this level of inhumanity needs to be exposed and needs to be documented every single second. And it's the levels of cruelty that the Israelis are doing on daily basis in Palestine to the people in Gaza and to the people in the West Bank and to the people in Lebanon and elsewhere is just staggering. So we have to expose it and we have to do this together. Thank you. We just we're trying to connect the media with our colleagues in Gaza. So somebody talked about Democracy Now, and we're trying to connect them with the attorney of Dr. Abu Safiya as we speak. And also, if anyone has the emails for American Academy of Pediatrics, the emails for American Medical Associations, any emails that can be helpful to us in advocacy, info@doctorsagainstgenocide.org. We are looking forward to hearing from you all.
Yeah.
Thank you. Nidal? I don't know.
Dr. Karama, I think
تفضل
there
دكتور
was a
يوسف.
suggestion at one time that we are in need to have like a white coat ambassador in each country. And so he will be like the link person between Doctors Against Genocide and the doctors at that country. And just to be like the ambassador of the white coat. I think this is the time to go through this suggestion. And now I can invite all of our colleagues, anyone who found himself he will be suitable for that position. Please just be in contact with Doctors Against Genocide just to start that issue. The other point, I think it's so important to start by the awareness, which is started by having like a meetings between our doctors who face such catastrophic situations in the who are detained at one time or being working in so difficult situation with the doctors in the different countries to hear from them about their stories, their humanitarian experience. I think to start by the awareness, this is the first step. Although we are not going to wait, we have to go through many other different activities, but at least to go in that direction plus the other directions.
100% agree. And if anyone wants to nominate somebody or nominate themselves to be ambassadors for Doctors Against Genocide, to connect with the doctors in Gaza and to lead advocacy work wherever they are in the world, please email us. Again, info@doctorsagainstgenocide.org. And I'm sure we will hear from a lot of people. Thank you, Dr. Aburish. Unfortunately, I was really hoping to hear from Ahmed and the Gaza birds. He was in our webinar for a while, but he left. And also, we're hoping to hear from our colleague Munther, who just lost his brother, get this, his brother and his nephew, who are both strawberry farmers. And as you know, Munther, you have seen him. Munther is our friend who has been making every one of us feel so elevated because of the amazing farms that he and his cousins have been rehabilitating in very close to Beit Lahia. And I think the Israelis know that this running a farm is something that will uplift the spirits of the people. And anyone who does that becomes our target. In fact, now I myself being in Nablus, and Nablus is a city that is known for olive oil and for Palestinian soap, Nabulsi soap that is made of olive oil. This year, the Palestinian farmers have not been able to farm to harvest olives. There's no olive oil, and the factories that make Nabulsi soap have to get the oil from Greece, Turkey, Syria. This has never happened before. So the attack is on the bodies, the attack on the lives, the attacks are on the well-being of the people, on the farmland, on the olive trees, on the roads, on the life fabric, on the community itself. And the only thing that saves Palestinians and helps them maintain some level of feeling human is really each other, because communities do take care of each other in Palestine. And the biggest example is Gaza. Gaza only survived because the doctors, the nurses, the engineers, the teachers, they banded together and they continued to work together to save whatever that can be saved. Thank you.
Thank you, Karama. There is someone here has the name Nidal. I don't know. Did you speak before, Nidal? You're under my name. I shared
That's
my
you,
link with you.
Nidal.
Oh, that's me? No, there is another one under my name.
Okay.
Dr.
Did
Raed, I think he was Dr. Raed.
I think we did change Dr. Raed. Let's see who's that, just to make sure we'll not miss anyone from speakers today.
I changed Dr. Raed, so it would be somebody else.
Yeah.
Do you remember
Anyone,
who
please,
sent it
can
to?
you speak? Can you speak? He just opened their mic. Can you tell us who you are, please?
نعم دكتور الله يعطيك العافية.
الله يعافيك. مين بيحكي والله؟
He is Dr. Raed. He is Dr.
معك
Raed.
الدكتور رائد.
دكتور
دكتور
رائد.
رائد
اوكي اهلا وسهلا. يمكن غادر ورجع كمان مرة. اوكي اهلا وسهلا. So I think we can open it to the panelists now to hear from them. What's their ideas? What's their take? What can we do? And we have Father John with us today. Father, you listened. You heard what our colleagues shared from Gaza, what the families of our colleagues shared from Gaza. As a father, as a priest, I know you started this organization, Priests Against Genocide, and we're really grateful for you, grateful for your work. And we, again, want to try to see how we can work together to elevate the message across not just the medical community, but all other communities, including the faith community. Do you want to share with us anything, any feedback, any ideas about what you heard, what you heard today? Open your mic, please. You are muted, Father.
There we are.
Yes, perfect. أهلا وسهلا. احنا بالعربي بنحكي أهلا وسهلا. Do you know what أهلا وسهلا means?
Peace.
أهلا وسهلا means welcome. You are welcome.
Oh,
We
welcome.
want part of the campaign. We want the whole world to learn Arabic and learn Quran too.
I wish I could learn to speak Arabic as well as all of you speak English. That's a wonderful gift.
Thank you. One word at a time. أهلا وسهلا. تفضل. Can you please share with
Okay,
us
Salah.
your feedback,
Okay,
any
Salah.
ideas?
I feel
Salah.
very welcomed, and I want to simply speak on behalf of Priests Against Genocide. I don't think that we are doing as much as we can. We're still trying to get numbers. We're still trying to increase the level of pressure that we can bring on various places. But just one moment, I want to turn something off here. There we are. So I'm discouraged. I'm thinking, for instance, of the July 12th or 15th and beyond that. I wish that we could have more priests there. And we have some in the area, but I'm not sure they'll be able to make it. I'm clear out in Oregon, or I would be there. I'm thinking along with the wonderful project that Annie Habibi is working on for September. We are working with her group and your group to prepare for something pretty significant, but that's up to her to share with you at whatever level. What I want to emphasize again is that Priests Against Genocide is a movement on behalf of humanity, not a religion. It's a movement on behalf of human rights, of the needs of ordinary people. I'm so moved today by the witness of all the doctors and other healthcare workers that are still in prison, and not only in prison, but are being tortured and interrogated in ways that go beyond all the Geneva Conventions, beyond all the things that the United Nations speaks of. And so I share your alarm. I'm going to try to write another article if I can in between working. It's interesting that for me, at this time of my life, this work has become like my third career, and I'm going to pursue it with passion. And I feel like it is a call from the Holy One to do this work on behalf of other priests and other healthcare workers like yourselves. The final thing that I would say is how much I deeply respect the commitment and the passion and the compassion that all of you bring to this. I'm just deeply inspired and very grateful. Thank you so much, and thank you for letting me share my reflections this morning or this afternoon.
Thank you, Father John. Thank you. And I know you like for us to call you John without Father. And
That's right.
yes, these are all movements for humanity beyond faith, beyond colors, beyond borders, beyond professions. We are all here for one humanity, for universal values for everyone. The attack on Gaza is a reflection of all the wrong systems that have been controlling our humanity, and it is up to us, all human beings, all faiths, all colors, all nationalities, all ethnicities, to mobilize, to unite, to create a better world for us, for all of us, for our children, for our generation, for the coming generations. We are really inspired by you, and inshallah we'll keep working together. And I know Annie and Martha, the other mothers now, Mother Annie and Mother Martha will share with us their reflection, what they are working on, and what do they want us to do, what can we do. Who wants to go first? Martha, are you there? Go ahead, Martha.
Martha, are you on mute? I at least can't hear you.
I cannot hear you too. Martha? It says you're not on mute, but there's something with the connection.
Do you have headphones? Maybe you can do the audio.
Let's go to Annie while Martha figures out the connection.
Okay.
Go
Well,
ahead,
this
Annie.
was a devastating call, just devastating. I can just feel Dr. Abu Safiya with not being able to sit, with his face broken by whatever instruments they used. And so while we've been on this call, we have a little subgroup with Priests Against Genocide asking, is there any way to reach the Pope on this? Also, the Prime Minister of Spain has just received a reasonably large contingent of medical evacuees from Gaza and was very pointed in what he said of our humanitarian duty for these evacuees. And I think we should try to reach the Prime Minister as well. So those are just a few side things I wanted to reflect on. It goes without saying that I'm going to ask everybody for money. And I'm not even going to explain why. After hearing this, just it's a privilege and an honor to try to get any money into Gaza that we can. It's not only a personal privilege and honor to be able to support Gaza, but still DAG is able to get money in. And you should not overestimate that. It hopefully will continue for some time, but I've also gotten money into Gaza, and it comes with many challenges and it comes with repercussions. So I'm asking you to support the doctors and their families that we've heard from, support the rebuilding of the hospitals. And the support now matters so much more than in 3 weeks or 3 months or 6 months. We just have to front end everything we can. So beyond reaching the Pope and others that I hope we can get to, I hope you will ask somebody into the DAG community. I hope you will consider monthly donations. Amazing website that DAG has prepared for everybody. And this work, they take nothing, not a dollar goes to DAG apart from printing leaflets or posters. This is it. The rest goes directly, and we know, to Congo, to Sudan, to many other places we need to hear from, but I think today speaks for itself, and I hope you will go on the website. Even if you're a current donor, will you give a little more? Will you bring somebody to the next call? Because how we reach people is through the Sunday calls. And again, thank you for all the speakers today.
Thank you, Annie. Thank you for your help. Thank you for your support. And yes, while we're working to end this genocide, to release our colleagues, Gaza needs a lot of help, a lot of rebuilding. And you know that they are using the humanitarian aid, whatever minimal stuff they allow to get into Gaza, as a tool, as a weapon of genocide. That's why we need to help the community there survive this intentional deprivation of aid. We need to help them survive. We need to help their families. We need to help the hospitals to continue to function even at the minimum. And any donation, any help, we will make sure that it will go to the people who really need it most. And we will use it in the most judicial way to make an impact. And every penny helps. So thank you, Annie. Thank you for your help. Martha, you want to give it another try? Martha? No, still no voice. I'm sorry, Martha. That's okay. Next time. We have to figure out what's the problem with that. We have Dr. Swiyang from the UK. Dr. Swiyang, any ideas? I know you've been very active in UK with the doctors, with the healthcare institutions there. What do you think? What are your reflections? And what else we can do based on your long experience with these spaces and the activism and the global mobilization? Go ahead, Dr. Swiyang.
Okay. First of all, I've been very upset, because for 1 year, I've been trying to pressurize Amnesty into adopting Dr. Abu Safiya as a prisoner of conscience. And I think somebody in DEC tried to do the same in the USA. It didn't happen. Not that he won't be tortured, but my point was either he dies a prisoner of conscience or he just die accused of terrorism. And it is really horrible. We are watching crimes against humanity, torturing a prisoner, killing a prisoner without charge is actually a crime. It is a war crime, especially when they call Abu Safiya an illegal combatant. That was what they accused him of. So I think down here we have already started a big petition to our foreign minister and our home minister, Yvette Cooper and so on. Yeah. I don't know what will happen, but tomorrow, coincidentally, I'm going to speak outside prison where the direct action people are going to be charged in trial. The Fulton 24. This is a few of them. So instead of talking about direct action and us, misusing our power and weaponizing the Anti-Terrorism Act and so on, which is actually what I want to talk about. I think I'm going to talk about Abu Safiya, and it is on our conscience too, because at the back of my mind, I kept asking myself, have I done enough? And somehow I just feel that there was something more I could do but did not do. I don't know what it is. So in terms of reflecting, I've just had a long conversation with Ghassan Abu Sita. When we talk about the Palestinians, especially for those of us that has been with the Palestinians for a long, long time, the current phase that the Palestinians are going through is accelerated ethnic cleansing turning into genocide. So our response should be accordingly. So first of all, in ethnic cleansing, how do we help the people stay? And we talk about the health workers and the doctors who has got no salary coming back to work in the hospital without pay at all. How to support them? Then the younger doctors who actually need to come back to the hospital to train. and not go and work in a local cafe or something like that just to earn some money. So that's what we can support. Now, of the hospitals that have been destroyed, all of them has been destroyed partially. There are those who are still intact in some way, like Kamal one, like Shifa, like Nasser. Those hospitals, we will have to support to keep them functional. Because without a focus of health, it's just, hospital is very special. Because when people see a hospital, they say hope. They think that, they don't think, they believe that life will continue. So to have people without medical care will leave them destitute and desperate. So we got to address that. These are three main things we got to talk about. And then within our own country, we have to deal with our institutions who are totally complicit. In the first instance, let's talk about my medical associations. They are all complicit. They're complicit in letting the genocide take place. They're complicit in silencing the doctors of Gaza, silencing us, their own doctors, from speaking up. Silencing witnesses is a crime. It's a war crime, right? You do not get your witnesses. Secondly, denial of genocide is also a war crime. So I think whether it's our medical council, whether it is your American Medical Association and our BMA and the Canadian Medical Association or the Australian, our health institution or our regulatory are all stained with complicity and enablement, aiding and abetting genocide and war crimes. And that is our duty to really call them out. There's no choice. It's a difficult thing to do, but we have to do it. So tomorrow will be a very busy day for me. I've taken a day off to go and support the trial, but I will start off by contacting the lawyers to see whether they can actually file complicity, aiding and abetting war crimes with these institutions. And then outside the court, we will address the specific case of Abu Safiya. Because he's such an important and pivotal person, but also he embodies the best kind of doctor on earth. Kamal Adwan is relatively preserved, not so badly damaged. And why? Because the doctors was ordered by the Israelis, say, we know who are the doctors. You come out, then we won't shell your hospital. And that's when we have this picture of Abu Safiya walking towards a tank to surrender himself and his life to save his patients.
Thank you, Dr. Swiyang. Yeah, please let's continue on WhatsApp groups about brainstorming the actions that we need to take, all of us. Thank you for your support. We really appreciate it. And we appreciate every new idea, every new coalition, every new voice we can get into this movement for humanity. As Father John mentioned, we need all of us. And yes, we can make a difference. Never feel discouraged or despair. It only makes us stronger, and we need to live up to this moment. This is a historical moment, and we really need to make sure that humanity wins, not injustice, not supremacy, not genocide, not war crimes. Dr. Phil Brewer, do you want to share anything with us, Dr. Phil? Phil, are you there?
I'm here. Thank you.
Yeah, go ahead, Dr. Phil.
I've been as I've been listening, I've been doing a sort of an internet search looking for medical organizations and medical organizations advocating for Dr. Abu Safiya, as well as media accounts of the current situation. And I'm compiling these into a letter, which when I'm done, I'll send to the DAG website. And their notable thing to me is that none of the major media organizations in the United States has anything at all about the situation. The Australian Broadcasting Company, ABC, but not the American ABC, full story about this on their news broadcast. There are very few, none of the medical organizations I've looked at, the American Public Health, AMA, et cetera, have anything at all to say. And I'll have a list of the ones that I couldn't find anything. There were two that were helpful. One was Amnesty International, which has a what I thought was a good information page and sort of reference page if you're thinking of writing a letter, making phone calls, and so forth. Take a look at the Amnesty International uh, uh, kit, if you will. It'll help make your calls more effective. I certainly plan on using it. And then the one organization I could find, of course, besides ours, um, is was Physicians for Human Rights Israel, which also had some suggestions which I think might be helpful to us. The global organization, Physicians for Human Rights, has nothing about it on their webpage, and I find that to be atrocious. And I plan to try to chide them into doing something because this is not a secret. Democracy Now! Had a very good story on it. So anyway, I don't need to say any more, but I'm going to keep working on this as we go along, and by the end of the afternoon, I'll send this out. And like you say, we've got to do something. We just
So,
don't know what new thing we can do.
Dr. Iman
That
Husni, are you there? Dr. Iman?
I'm here, yeah.
Yeah, we have to do something this week, something urgent. I agree, Phil. We can do it. We can do
yeah.
it. We have to believe so. Fadal Iman. We have been working on a few ideas too.
Yeah, no, I wanted to thank the family members for sharing about their fathers. I know that just that alone must have been very difficult for them to have to speak their father's experiences to us. And so when Nidal was saying, we can't feel helpless, that is really the Israel's hope is that people feel helpless to do something. So I just was putting some emails together for us to send to Congress, to the AMA, to the AAP, to the AFP. And so it just, based on some of the things that we were told today, some of the statistics, including Dr. Marwan also, and all the other healthcare workers. And so definitely we need to do something this week. The other thing I was trying to think of is like, anybody on this call, think about who are the people of influence that that might be able to do something, because all of us know somebody who knows somebody who knows somebody, right? And so we're definitely going to try to reach out to the offices that we've been going to directly with the people. Like I sent to, because I have good relationships with folks in my Senate offices. So I already sent those out today and personalized those. So I think we'll be doing sort of a general phone call, email, um, thing that everybody can do. But like if you can send something personal to your own senators, reps, um, I think that will be very helpful because I know that in all the time that we've been going to the Hill, they always speak to how the other side is bombarding them with emails and phone calls, and we need to do the same. So, set an alarm on your phone and keep calling the offices. They need to hear from us. They need to have that pressure. But like I said, think of maybe the people of influence that we might know, or I don't know how you reach out to that we had reached out to Miss Rachel, but like, I mean, there's a slew of influencers and like, actors actually all that are pro-Palestinian. I don't know if we can get this information out to them so that they can kind of put this out to social media, but I don't know how you connect with these folks. And so we just want people with the loudest voices to, be shouting about Dr. Abu Safiya, Dr. Marwan, all of these folks. So yeah.
Yeah, thank you, Iman. Dania, you and Iman always come together. One package. Your turn.
Hi everyone. I don't know what is there more to say, honestly. I beg everybody on the call because I'm noticing a pattern here. We're very reactionary. I want everybody to preserve this feeling of rage and anger and this love that we have for Dr. Hussam to carry into not just by the time we get off this call and everybody moves on. Like I need us to this week, like live, breathe, let it be at the forefront in everything we do. It's like Dr. Nidal said, we can send each person on their own can send 10 emails. They can make different calls throughout different senators, different reps. Like, let us not just be reactionary. That feeling everybody was feeling yesterday when the news came out, that feeling that, that very emotional response of, have we done this? Have we done that? Let us all carry it into the week. Let us live, breathe. We cannot keep having Ilyas on the call every week. It's abusive. It's a form of abuse for him to come on here and to beg us and to, with his raw bleeding heart, just sit in front of us. And as he's hurting, talking to every media outlet he can and not stopping, it's abusive. We have to do more. And we shouldn't stop what we have been doing. Like I know Dag is doing a lot of stuff behind the scene, but I think I keep coming back to this word creative. And we have gotten I've seen a lot of ideas in the Q&A about things we can do. And I think that's what we have to keep our juices flowing of like what can be done. When these people, when the genocidal entity threatens Palestinians in general, it's not just, they're not open threats. They've made examples out of people in the past. This is, what they do. So if Dr. Hussam is saying this is the last time his lawyer, his family may see him alive, it's not some euphemistic, statement. So please let this rage, let this love, this is a love that we have for him. Let us carry us into the week and the next week and do everything we can. Thank you.
Thank you, man. Dr. Esperanza? Catherine?
Yes, I don't have much to add in terms of concrete things, but I will say, I saw in the comments, people also being worried about retaliation that may come to us in doing this advocacy. And one thing that I often go back to is just looking at the photo of Dr. Abu Safiya walking towards the Israeli tanks. And like, if he can do that, I can, do this work too. And that courage is, not the absence of fear, but taking action in spite of fear. And also that if anything happens to us, that DAG has our back. I'm currently facing trial for my advocacy against ICE, and like the reason why I got out of jail was because DAG supported me and called so much. And so also to do this, with all the fear that we have, and to know that, we have each other's backs as well in all of this. So to go forth with courage in the face of fear, and know we're all supporting each other.
Yeah, thank you, Catherine. Yes, calling does make a difference. And we need to make tons and tons of calls this coming week, starting tomorrow, please. Everywhere you can, every phone number you can get hold of, please call. Make sure that this is going to be the discussion of every office all over the world for this whole coming week. Regardless of whether it works or not, we want to make sure that every office, wherever it is, that's all what they're hearing about this whole week. Thank you, Catherine. Dr. Maribeth Brownlee. Maribeth, are you there?
I'm here. I'm here.
Yeah.
I think many wise people have already spoken all that would need to be said in this moment. I don't know that I have anything substantial to add. The good idea fairy's floating around. If anything lands, I'll discuss it with the group when it lands.
Yeah, inshallah, we're going to have a meeting for us, DAG, after this webinar to plan this. So if please try to be around, available. We're going to have a meeting soon for all of us to see what we're going to do going forward. Dr. Kuram, are you there, Kuram? Are you with us? Kuram Janjua? Dr. Kuram? Yeah, go ahead.
I'm here. I don't know what else I can add as well too. I think Dania made a great point that it is extremely abusive having Elias on here repeatedly over and over talking about his father. There has to be more than we can do. I know we're all doing a lot. So thank you everybody for all the suggestions that we've had in the Q&A. I'm trying to strategize whatever I can. I know Monday, the first thing I'm going to do is go to Van Hollen's office. We have had correspondence back and forth. They promised us that they were going to send a letter. They promised us they were going to do something. But we have to continue to keep pushing them. Like Dr. Jabour said, there's way more that we all should and can be doing with calling. We've been told multiple times at the Hill that this stuff does matter. They have to tally them. Even if we are leaving voicemails or not getting a actual person, they have to tally them. And we've been literally told by people, by staffers, that these things focus on trends, and we've been told that like certain things might not be trending anymore because they're not receiving enough calls. So for people that think that this stuff does not matter, it absolutely does matter. So please continue to do that, whether it's emails and calls. The other thing I can think of is I'm 35-40 minutes from DC, so for the people that do not live close to the Capitol, every congressperson has offices within their respective states too. So if they can please at least try to contact them at their local offices as well too, whether going in person if they need to, or even just calling them. I think that's a good idea there as well. But please, if anybody else has any other suggestions, whether it's media contacts or things like that, please feel free to email them at info@doctorsagainstgenocide.org, so we can kind of compile a list and be able to either send an email blast to them or just have something structurally laid out to make it a little bit easier to email all these contacts. Apart from that, I don't know at the moment. I think just strategizing, like Dr. Jabour said, we'll have a call after this and think more. Yeah, that's really it though.
Thank you, Dr. Janjua. So yes, call. Please, whatever you are doing this week, whatever other activities you have for in this movement for this coming week. Let's put everything on hold for a week. And let's make everything, all what we do is just call, email, send letters, remind others to call. Let's make this week, everything we do is about the doctors, about Dr. Hussam, Dr. Marwan, their colleagues. I know there is always other things happening, other things needs to be done, but let's dedicate this week, please. This is top urgent. I don't think we will have an opportunity after this to brainstorm for this. So I personally am gonna put everything else I do for this coming week and just be calling everyone and reaching out to everyone, sending emails, letters, campaigns, preparing campaigns. So please call, and call everyone. Your elected official, your Congress, your senator, your State Department, your foreign ministry, your ambassador, Israeli embassy, the AMA, the hospital, the CEOs, the American Pediatric Academy, the American Psychological Association. Let's call everyone. Let's make sure that it's not just us. It's not Dr. Hussam. It's not just his family. It's not Dr. Marwan. That everyone, no one will feel comfortable until our colleagues are safe. So thank you, everyone, please. And let's have a meeting after this. And everyone who has any ideas, please email us as Karam and Karama mentioned, info@doctorsagainstgenocide.com. If you are sending letters or campaigns to your officials, please copy our email, advocacy@doctorsagainstgenocide.com, so at least we know what's happening and we can amplify the message. And if there's any good ideas, we can create bigger campaigns toward them. So we are all working together instead of everyone working on their own and in silos. Please feel free to copy any of our emails, either info or advocacy@doctorsagainstgenocide.com for any action or any email or any letter you're reaching out, and also provide us with any ideas and suggestions. And let's think more about also, while this coming week, we want to call, send emails, letters. Let's think about the July 15th. Like, if none of our calls are listened to, if no one is responding, we need to have a global healthcare and medical campaign, 1 hour of support to our colleagues to bring their voice, that we can escalate into more in the coming weeks. Dr. Yusuf, any final comments, any final ideas, summary? Dr. Yusuf, are with us?
Yeah, I'm with you. All of the idea are actually great, and the most important points now to convert them to action. As you mentioned before, lots of things can be added to the already existing situation. Anyone who can add more and more. So the message for me, myself, and for my colleagues, this is the time of action, and let's convert our idea to action. Thank you all for your great participation and your great meticulous ideas and the effort. And we hope at one time we'll invite Dr. Hussam Abu Safiya with us again.
Thank you, Dr. Yusuf. Thank you, everyone. And don't forget, this week is all about our colleagues. Just dedicate this whole week for them. We can pause everything else. We can do it the week after. For now, we want to make this week for them. And please do not waste a single minute, a single hour without doing something, either a call or an email or an idea. And for our team, we're going to have another Zoom after this if you're available. And Dr. Swiyang, go ahead.
Yeah.
Go ahead, Dr. Swi.
I've just been texting the press. So if anybody is interested in doing a story on Dr. Abu Safiya, would you, Karme, or Maisa talk to them?
Yes, we're available. All of us, any one of us, we're available to speak to anyone, talk to anyone.
Yeah.
Yes, absolutely. Yes. This whole week is going to be dedicated
Okay,
quad-captor,
you can
yes.
put a press release. Maybe nobody comes, but we just try. Okay. I
Inshallah.
think they would. I would prefer them to talk to someone from DAC.
Thank you. Thank you. Please connect us. Yes. And again, this is all intentional. Genocidal regimes,
I
genocidal
know.
nations, their intention
It's
is to break
murder.
us and to break our solidarity, to break our humanity, to make us submit, to make us ignore, to make us feel like we are helpless. But we are not. There is a lot we can do. Let's show them that we can do more and that we can put an end to this and that we can free our colleagues. We are not helpless. If we can dream it, we can make it happen. We can make it reality. We can make a better world. We have to create a better world. Otherwise, it is their world that will become the reality of our children. Does any one of you want your children to live and endure what we are enduring now, what the people in Gaza are enduring now, what the doctors in Gaza are enduring now, what the doctors in these prisons are enduring now? If you accept this, then we can just move on and go back business as usual. We do not accept this for ourselves. We do not accept this for our children. We do not accept this for humanity. And it is a battle of, I mean, honestly, at this point, it's a battle of will. Who has the more will and who has the more courage and who has more determination. And I do believe that we, the people, we are more of us. There is more of us. We are a bigger movement. Most of the humanity is on our side, and we can make it happen. So please do not feel despair. Please do everything you can. Dedicate this whole week for our colleagues, and let's make a win here. One win, then the week after we make another win, then the week after another win. Let's start with one focused campaign on one single issue, and we will win one battle at a time, inshallah. Thank you, everyone. And get ready, prepare your list, prepare your phone numbers now. So starting first thing in the morning tomorrow, we're going to be calling everyone every day, all day, for a whole week. Thank you. Stay strong. And free Palestine, free Dr. Hussam, free Dr. Marwan, free Dr. Ghassan, free them all, bring the hostages home. And this is to Israel, and this is to the imperialist United States and their supporters. We shall win. We will prevail, and you will lose, and you will be held accountable, and you will be charged with war crimes, all of you. Everyone who's committing these crimes, everyone who's enabling them, and everyone who's silencing us. We shall win, and you shall go down to the dustbin of history as the criminals and the war criminals you are. Thank you, everyone. Inshallah, we'll see you next week. Please don't forget, this whole week is dedicated to our one mission, one focused, laser focused mission to release and to save our doctors and our police. Yalla, salam. Salam, everyone. Thank you.
Salam.